Good morning, participants. I'm just going to allow another minute for people to join, and then we'll get going. Thank you. Beautiful day in Cape Town today. Don't know about Johannesburg. Okay, I think we can get going on my side. I would just want to do opening remarks. My name is Lusani Mlaudzi. Those of you who we haven't met, and welcome to the Public Interest Seminar. And we started doing this in the year 2020. And I'm the Public Interest Actuary appointed by the Actuarial Society of South Africa since 2019, with a very simple job to create a bridge between us as a profession and the broader public out there, but more so the policymakers. What I'm going to share in my opening remarks is just what we've been focusing on, what our objectives have been, and then also about the program today, the agenda today, and what we will be covering and why we picked some of those topics that we'll be covering. If you look at our 2024 objectives, we've been focusing on co-creation as part of our strategy. As for 2024, we're looking at the projects that are happening, the big policy projects, NHI being one of them. The National Social Security Framework, that has not come up. We thought it would come up this year, but it hasn't. The NHI has been taking up a lot of media space and discussions, I'm sure, also at the BRI. And then also the issues of higher education funding are very much top of mind. I think the minister also did a presentation yesterday, the new minister, the NSFAS issues. So those are quite important. Why are actuaries involved in that? We've done some modeling. I know Mike McDougall, as the former CEO of the society, did a modeling exercise that was presented to the HEA Commission. From time to time, we get asked to serve on task teams. I'm serving on my second one on higher education. Our role there is to assist with some of the modeling work that's required. So it's a very live policy space. And then there's been this focus this year on applied demographic modeling. We will have a topic later on talking about the area of demography as a research field, but just looking at the relevance of it. And there's a very close relationship between demography and actuarial science, but there are also differences. And then just also the aspect of cost or risk benefit analysis is something that I've been trying to employ in different areas in my own research work and so on. It's a very important aspect or a tool that as actuaries we can use when engaging in policy discussions. And then we are also busy with a strategy review. We have had this public interest strategy in place since 2021. So we're reviewing that so we can have a new one going all the way to 2028. And we've had to work on the way we communicate. We now have a special section in the ASSA website. I wish I could actually show it to you. I just don't want to tamper with things here. But later on, I'll look at an opportunity to show you where there's a public interest section. If you look at the top of your of the Actuarial Society homepage, you'll see public interest. If you go in there, you'll see all of the topics that we've handled over time, over the years, and all the topics that we covered in the public interest seminars in the past. So we're trying to put everything in the same place so that you can find what you're looking for. And then just to set a bit of context in terms of our nation, I think many of us are very glad that the political choices that have been made after the elections were made. We think that the government of national unity presents quite an opportunity for the country to move forward in several ways. So some of the aspects that I took from the State of the Nation address is a focus on inclusive growth. So that is something that we need to bear in mind when we're discussing issues, is this something that's going to lead to inclusive growth, meaning it's growth, but it's going to benefit many. The issue of stabilizing debt, reducing debt servicing costs, I think that is top of mind and is something that I think actuaries can increasingly get involved in. Currently, not many are involved as much as far as I'm aware. And then the issue of public infrastructure is a big issue that requires public-private partnerships. And then the issue of municipalities, I think it will come up in the policy discussions that we're going to be having, especially in the first panel. It's a big problem. A lot of municipalities are struggling. They fail to do the basics. So there's a focus on that. It's something that one wonders whether how we're ever going to be able to get it right. And then the issue of basic income grant or the SRD, the continuation thereof, that will be handled in the afternoon. But it's a very topical discussion, and it's one that actuaries would be called upon to understand the costing thereof, not only now but in future, in terms of that population or the number of people that require that basic grant. And then NHI, the infrastructure aspect, the training and digitization, the public-private partnerships aspect of it. We've got 90 minutes dedicated for that today. So that should help us. And I want to encourage you to ask a lot of questions, because that's why we made it 90 minutes, so that Anban can really have an opportunity to deal with the questions. There are political discussions that are happening. We respect the fact that we are not the politicians. We just need to be ready to make things work. And many of us will be involved in different ways. It's okay as actuaries to be involved in different ways, but we need to understand what needs to be done and how does it have to be, how can it get done and so on. But any question that you have in terms of that, you will be free to ask that. And then the issue of just the professionalization of the state, just making sure that in terms of state functions, things can just be done professionally and not politicized. That is something that was mentioned in the State of the Nation, and it's a question of how we can make a contribution towards that as a actuarial society. And then most importantly is really just in everything we do, just to emphasize the issue of cooperation. As a nation, that we need to cooperate. We're a nation that is we're an unequal nation. You've got people that are very well educated and well-to-do, or have access to many things, and you have people that don't. And how do we actually move forward like that? It's something that we need to look at. And then also, I think what is important is that you will see sort of using different terms. We'll talk about public interest, as I'm the public interest actuary. And then at times I'll be talking about public policy. You will then wonder what is the difference. So when you look at public interest, it refers to common well-being or general welfare, anything affecting the rights, health, or finances of the public at large. So public interest is all-encompassing, if I could put it like that. Public policy refers to governmental action. So it's what gets done, what gets put into the law, into the rules. Governmental action established and institutions that are set up, established to address the problems of the society at large. So the two go hand in hand. You have public interest issues that can be dealt with through public policy, but that doesn't just happen. That requires civil action. It requires a lot. It requires us to be involved to shape that. So yes, we would be referring a lot to public policy, but you must understand that we're coming from a public interest perspective. These are the things that we all have an interest in. So I think I should just clarify that. Now, in terms of the agenda, the first one is a panel discussion. We've got two esteemed guests here. Satish Rupa is a colleague of mine at the Commission for the Remuneration of Public Office Bearers. I said chairperson of Petro SA. That is a mistake. It's the Petroleum Agency. It's a regulator, different to Petro SA. Petro SA, a lot can be said about Petro SA. So, but no, he's not the chairperson of Petro SA. And he was the executive mayor of Potchefstroom City Council at some point. So he understands policy at the ground level. And he was also an MEC in the province of the Northwest, and he was responsible for the police ministry. So comes in with a lot of experience. As a lawyer, as a human rights lawyer, an activist, and many things that he will say when he starts. And then Tsepiso is an independent consultant. I was at university with her in Stellenbosch. She's a former special advisor in the Mpumalanga office of the Premier. And she's a consultant, labor, and many other aspects. So she's very much on the ground, and she will be also telling us how she looks at this issue of socioeconomic impact of policies and of policy responses. So, in other words, the governmental action or the things that government wants to do, how is it actually impacting lives, and what needs to change in that? So that's what we're going to be dealing with, and that's the first topic. And then we will talk about higher education funding. Stan will do more of a presentation there. Stan is a professor. When I was a student in Stellenbosch, he was, I think it was just before he became a professor. I think he was still doing some of his studies. And he's going to be talking to us about, in terms of his perspective on higher education funding and the challenges there. He's the current Chief Operations Officer of Stellenbosch University. And then after that, between 10:45 and 11:30, we're going to have looking at the impact of demography research on public policy in South Africa. We've got Dr. Lee Johnson from the University of Cape Town. He's an epidemiologist and also an actuary. And then we also have Prof. Tom Moultrie, is a demographer. And he studied actuarial science at UCT, but then he did his doctorate in demography. He will explain that better than I can. One of the universities in the UK. And then between 12 and 1 o'clock, 1:30, that's when we'll have Anban Pillay, and we will just it's a deep dive into NHI. So you don't want to miss that. You don't want to miss any of these topics. And then after lunch, we've got Stephen Walker and his team, Joanna, Megan, Alex van der Heever will join then, Rob Rasconi, Tawanda. They will be talking about social security issues, basic income grant, two-pot system, and other social security challenges in South Africa. So that is my story. There's some research that we are doing as the public interest actuary and the research team. And some of them we have found people to do them. Some of them we still need to refine them. But for now, I'm just going to stop here. Stop sharing, and I'm gonna hand over to our first panel. Satish and Tsepiso, I've already done a bit of an intro on about you guys, so I'm just gonna hand it over to you now. Satish, you are going to go first. Thank you.
Good morning, Lusani, and a very good morning to all the attendees on the platform. A big thank you for inviting me to make an input in 10 minutes, 15 minutes, when I had to do value analysis and policy formulation at Stellenbosch. I see a number of us share Stellenbosch as a home where we acquired knowledge. Clearly, it required a lot more than what we are currently talking about. Aaron, I just want to make sure the screen is not showing, Aaron.
Hi, Satish. The screen is sharing.
If we can go to the first slide, thank you. There we are. So, good people, my introduction into the policy world started in 1994. As Lusani has indicated, I was appointed as an MEC for, then it was called Safety and Security, which took charge of the police. I had to do transformation and amalgamation of the police from the previously broken up country, the homelands, Western Transvaal, Northern Cape, and parts of Gauteng. 6 months later, when I was done, the Premier Popo Molefe then said to me, "But what are you going to do for the next 4.5 years?" And I said, "You tell me." And he added to my portfolio the transformation of the civil service in the Northwest, which also had different components like I've indicated, but the bulk of the work was in then former Botswana, but now called Mahikeng. So put in touch with professors and doctors in policy, I was totally out of my depth. And as a consequence of which I said, I need to go and upgrade my knowledge and therefore enroll for a master's at Stellenbosch, which was the closest to what could allow my growth and development as a practitioner in the policy field. So if we look at the slide, we're looking at 3 concentric circles. Policy really is something that political parties obtain in a democracy. They go to voters like you and me, and they say, hey, if we come into power, this is what we're going to do. We're going to have an NHI, we're going to have social grants, etc. We have a unique situation in South Africa in that we have an amalgamation of 11 different political parties that are part of the GNU. Each one had a manifesto when they went to the voters to vote for them. So it's really a mixed salad of policy outcomes that the different political parties had anticipated. And now they're weaving it into what they think is a collective that can all be honored by each and every one of them. So interesting space. I like the subjects that you are going to engage into. For purposes of my discussion, just use NHI as the subject that we'll be focusing on. So if we look at the first inner circle, policy development starts from understanding a problem, let's say unequal health treatment to all South Africans. There's a portion of us that have medical aid. I think we are 8% and we dominate in terms of the resources available, but you will find that there is insufficient capacity and no resources available in public space. Now we develop solutions, and government has come about with the NHI, the president signed with great fanfare and conflict on Friday. Fortunately, reason prevailed, and 2 provisions have been extended in order to ensure that we don't run into any difficulties. So once we've developed solutions, we go into implementation. That is the cutting edge of our problems. You have a subject capacitation of the state. That's something that you need to look upon. You need to evaluate whether your policy outcomes are achieving their objectives, and where necessary, you course correct in order to make sure that you do the adjustments that are necessary to achieve your policy outcomes. If I can invite you to look at the second part of the circle. So we say, what is the impact of devolution? In other words, can we take this particular issue in society and from national take it to province, take it to local government in order for us to achieve outcomes? How should work be organized? That's crucial if we are going to achieve our objectives. How should frontline staff be involved? Because they are at the cutting edge, and if you don't involve them, and there was a video that went viral last week of a patient at Helen Joseph and the kind of treatment that he experienced. So it's important for your frontline staff to be involved and agree that they are part of this journey. Then what sort of cross-cutting interventions is required, if any? So if you're looking at the NHI one, whether you need service providers to come and improve service delivery of front-end workers, whether the doctors need improvement, what are those cross-cutting issues that an intervention from other departments or private sector, which is a good thing, can come on board in order to address those challenges? Then what is the impact on other existing and developing policies? One of the challenges that we have is policy uncertainty in South Africa. In the field that I work in, that's the oil and petroleum industry, there are about 15 different pieces of legislation, and they don't often talk to each other, as a consequence of which you find that the major companies that have a desire to invest in the country won't come, because as long as there's policy uncertainty, They don't know when the rules of the game will change, and they're not prepared to invest billions in a country that doesn't know the direction in which it wants to go. Then what are the cost benefits of different options? And here, good people, is where you play a huge, huge role. Because very often, in the absence of proper policy analysis, decisions are made at the leadership level without any consideration for the cost-benefit analysis. And your work is to assist the decision makers in understanding the reality when it comes from a budgetary point of view. Then what evaluation systems and performance targets are needed in order to achieve our policy outcomes? What are the alternatives to legislation and regulation? So a good example is that sometimes when you want to put things into law, you get the opposite impact. I'll give you an example. The governance field in South Africa, we have what we call the King Codes, King 1, 2, 3, 4. It's voluntary. Organizations can decide to comply. And the reason why King is not law, which in other countries, you look at America, they got the Sarbanes-Oxley Act. It's identical to King, but what that does, it's law. Ours is voluntary. So when you go the legal route, it is more likely that people will do a tick box exercise, but not genuinely commit themselves to the outcome of the policy that you are requiring. You need to, again, like I said, staff. What training and support for staff is needed? IT must have changes. How do you upgrade your IT to ensure that that which you seek to achieve is going to be obtained? Then at the organizational context, what's more, we say, what needs to happen to ensure policy becomes self-sustaining? Because if you go to play policeman over implementation all the time, there's a defect. It means you are forcing people to achieve outcomes, whereas you actually want it to become self-sustaining. Then how and when should policy effectiveness and contribution to corporate objectives be reviewed? That is about the timing. Are you going to review in 3, 6, or 12 months? Some policies' impacts can only be felt after a couple of years. They say government is a big ship, and when you want to turn it around, it takes a year or two before it's turned around. You ask a question, who else within government needs to be involved and how? And this is crucial because if you don't have a champion to push your policy outcomes, it gets lost in the bureaucracy. I go to the third circle, mindful of time. Is a cross-cutting approach needed? How and when should key political reps be involved? Are ministers signed up? And if you don't do the necessary lobbying, they can become very obstructive. What is the strategy for presenting policy? You've got to choose the platform, the venue, etc. so carefully. What are the quick wins? Because if you can demonstrate quick wins, you get a greater body of support of people following you. How can stakeholders be kept committed and involved? And here, having read some of your background material, I would urge you, colleagues in Lusani, to look at a stakeholder management process, because you have different stakeholders in the policy-making process. Not only is a national, province, and local government, but you have a number of actors as stakeholders that participate in this particular field. Then, who needs to be told what, when, and how? The 5 whys, which are critical for continuation. How can evidence best be presented? You've got to choose the correct medium. And how does a problem policy fit with government manifesto priorities? And I started off by saying each political party seeks to obtain power through their manifesto by persuading the logic of our arguments that will make us make a cross for them at a particular point in the ballot paper. Lastly, we look at the wider public context. What are the desired policy outcomes? So NHI, what is it that we seek to achieve? We want to make sure that no person, rich or poor, is denied the proper medical care in South Africa. Which are the most effective outputs for achieving these outcomes? So you've got to apply your mind. Who are the key stakeholders and how should they be involved? Without private sector, for example, in NHI, you're going to have difficulty because the state capacity has been hollowed out and it's going to take years to rebuild. What are the needs and views of those the policy seeks to influence or affect? Is there evidence that is relevant and useful that we can use currently in our application of a policy outcome? What have the experience of other countries been? And it's so important to go and look around because You take your bus rapid transport. It started in Brazil. Brazil scrapped it. We're still building it. So there has to be a reflection on what works, what doesn't work, and where. But it's also culture specific, so one needs to be mindful about that. Then what are the risks to the policy and how can they be managed? Because any new thing has risks and they're going to have resistance to change. So you're going to map out your change management roadmap with sufficient capacity to overcome challenges. Then what is the impact of possible solutions on equal opportunities, business, women, youth, the environment, etc.? And lastly, if we look on the left-hand side, how can different solutions be tested? You normally do pilots before you roll out the big project, because if you roll out your big project and you're now in deep trouble with things going wrong, and they will go wrong, it's a very big problem to resolve as opposed to a pilot project. And the last element is what evidence is needed and available to test the real world problem. So Aaron, if I can ask you to go to the next slide. And colleagues, we use this slide in our training over 4 days on policy development and policy analysis. So we've titled this High Unemployment, a Prison Without Walls. So I'm not going to talk to the details. I simply want you to reflect, and I hope that the slides will be available after today, on the issues of unemployment. So if you see its knock-on effect, it has an impact on crime, it has an impact on infrastructure, it has an impact on the growth of a human being with stunted growth as young people. There's decreased life expectancy. There's organized crime, which we are now experiencing. HIV is not yet out of the window for us. People who are exposed, as we learned through COVID, have a higher propensity of being infected or affected by any sickness that may arise that is not properly catered for. Then you have the issues of low schooling and interest. So a combination of a cocktail of trouble. Each one of us living in South Africa knows exactly what those mean. I'm going to end by saying that when we talk about policy, it's normally about policy outcomes, policy performances, policy problems, policy futures, and policy actions set at the high level, and I don't know intimidate you. But the most important part of policy is asking the right question. Because if you fail to ask the right question, you're going to get the wrong answer. And at that point, facilitator going to stop and say thank you for the opportunity to make these brief comments.
That was a great intro. I wanted to throw up a challenge out there to colleagues out there. I'm sure you noticed the similarity between the model shown there and the actuarial control cycle. I'm sure some of you were like, hey, that looks very familiar. It is. It's very similar. Just every time that you come across a new word, note it somewhere. And then also just do a count of how many times the word gets repeated. So I think that is how we sort of learn. So Piso, I want to now, we've been given a very good start. I just want you to now give us your take. Over to you, Piso.
Thank you. Good morning, all participants. Like they've said, my name is Tepiso Masenya. I have been involved in the policy space for quite a while, actually, at different levels within the public sector and also in the private sector. In fact, I worked in Parliament just after I graduated for about 2 years. Then before that, then I moved and came back to Mpumalanga. Now, I'm involved a lot with communities at a grassroots level. And a lot of my background entails that. And at that time, a lot of times, you know, when you engage with people, you kind of have an understanding of the process that it entails to develop policy, just as Satish has explained. And now you start looking at how does that policy impact and affect you as an individual or me as an individual. And when you're working with communities, you find that a lot of times that a lot of the policies that are out there, most community members either do not know don't have an understanding of it. It is far-reaching. They have a problem. So people at grassroots level, any citizen, you have a problem. It's not yet defined in a particular policy. It is just a problem. The whole context of an act or law, most of the time, people generally don't understand. And that does create a challenge in actual fact, because then how do you then measure your impact? You know, because when we talk about social impact of public policy, you're talking about the effect that it has on people, whether it is positive or negative. That effect is what is then needs to be measured. And what are we looking at to then define that? Because when you look at South Africa, we've had a number of policies, we've had a number of acts, and they change regularly over time. And we always have a lot of general statements and generalized statements that can be demotivating for our public sector, that can be demotivating to employees and to those who are meant to implement it. But then we've never really looked at what could be those challenges that are there that would cause public policy to fail, for a lack of a better word, or to not be effective. One of the challenges that one has picked up over the years in my experience. Firstly, policy can't implement itself. So we would go through, would go through a process that Satish has explained, and you identify a problem. But even in that identification of that problem, what one may deem as a problem, someone else may not deem it. The inequalities in South Africa are quite vast. And a number of times when we have to engage in developing a public policy then cuts across all these inequalities. We may say to some people to say that everybody needs to have flushing toilets. But there are some communities that when you put in a particular toilet in that area, for them, because of cultural beliefs, it's not applicable. There's so many things that we need to be looking into when you are implementing policy. So understanding the values of people, the beliefs, the culture, those are some of the issues and key problems that you find, because our beliefs are not always the same. And when the researchers or policy makers don't understand what really defines this problem that is here, it creates a problem. It has a consequential effect later on. And then we're all going to start saying that the policy doesn't work. One of the other bigger challenges that you have, human resources. No policy can implement itself. So if our human resources in the public sector does not have the correct expertise, does not have the emotional intelligence to then be able to implement and apply that policy, you're going to have a challenge with that. If people don't have empathy to relate with other people, your staff don't have empathy to relate with people, your policy may have a negative effect. If we don't have even competent human resources, then it becomes a challenge that where the impact of your public policy becomes poor. You have the challenge of time. Time becomes one of the biggest challenges as well when you're implementing policies. One case, an example, I want to go into utilizing examples. I view personally that local government should be the implementing agent of most policies, if not all policies, within the country. And the reason why I say that, it's because local government is right at the cold face of every issue that you have. An individual, whatever problem that you have that is related to public issues, for instance, if you've got an issue with your water and light, it's your municipality. If you've got an issue with your schooling, it will be going first, you'll go with your ward councillor, and then it's the school. But your Department of Education is there, but you've got your local ward councillors to address and assist you right here. So there are different systems at local level that are there, that are available to assist communities. Now, one of the key programs that a municipality will have would be your local economic development department, the LED. Very vital, because then it speaks to business. It speaks to empowering communities in terms of how they can uplift themselves economically. It creates a bridge between those who wants to start up business or those who are in business, you know, to reach and be available to markets. But now your LED, a lot of times is the person who is there does not necessarily have the expertise of how a business is run or understands what is required in terms to run a successful business or to operate a business. They don't have an understanding of the policies that regulate business. We all know that when you register a business, you register via CIPC. You have your tax laws that affect your business. But now you find that your LED officers or your LED department as a whole is not equipped or empowered to understand how SARS works, how DTI works, how the funding model works. They don't even know the funding models to go out with. And then you find people are stifled. People then don't understand, and you have the noise, because that's where noise starts at that level, to say, but government is not delivering its services. Government is not opening doors or unlocking doors, because then local government or the department responsible is not equipped. Say that they are then equipped. Let's hypothetically say that they are equipped with the tools and knowledge of how to run a business. They have to then, one of the bigger systems that municipalities utilize to equip or to empower communities will be through your BE process or your procurement process. In that process, when they are needing to procure, they identify businesses that are there. What you would then find is that business in itself, there's no follow through in terms of growth. The process that then is required to then grant a tender, something that should take generally 2 months, would take a year. So by the time you are utilizing, you've identified a problem that you need somebody to go supply or to build a school or to build toilets at that school, or there's maintenance that is required, the local municipality has identified that and sends out a tendering process for that to address a social issue. That procurement process just elongates for a long time, and you'll find that that problem is not resolved. Case in point, one of the police stations here had a fire incident, and it's taken them till today. It's over 10 years until today. That building has not been renovated, rebuilt, or sorted, but it's standing there, and there are funds available for such. And this is where we start asking, where's policy? What is happening? Because Treasury can tell you that there's always money that is disbursed, but money always goes back. Money always goes back. Now, it does affect how we grow. It does affect how we see the development of our community and of our country. One of the biggest factors, and I think Satish touched on it when he spoke about unemployment, and that unemployment would cause corruption. But corruption in itself has a huge issue on policy implementation, because failure, just when people are corrupt, inequality is inevitable, because it undermines our national development. It demoralizes government. When people take decisions that they're not supposed to be taking, it does become a problem. So I think it's very, very vital to always take into consideration some of these challenges that impact on policy. The issue of human resources, the issue of corruption, the issue of values, the values of our people, and how the beliefs that they have, the different beliefs, the different cultures, and how that affects on our policies. We need to look at also the time factor in terms of how much it takes to implement different processes to get to the outcome, and whether that, how we can measure that and how we can shorten that. We need to be able to ensure that public perception is also managed. There isn't enough consultation. And when we talk about enough consultation, it's in-depth consultation of issues that are there. It's easy to say we've got a problem of a billing system within our country, or the electricity is too high. But it's not the electricity costs that becomes too high. The reality and fact of the matter is you've got a huge number of people who are not purchasing or paying for electricity at all, and they're not charged. It's free. How does a state enterprise then recoup those funds? It's going to recoup them through those who are paying. And now that's something that doesn't get said. Now, all the problems, we have to go back to the root cause of that problem, because defining it at surface only makes things worse, because then we'll only then get policies that address a symptom and not address the root cause. And then subsequently, at the end of the day, we see that inequality continues to increase and continues to increase, not because nothing is not being done about it, but because our policies are in fact addressing more of a surface issue or a symptom rather than the root cause. I think I'd leave it up for discussion so that we can open up for any questions, Lusani.
Open for questions since the beginning, but I don't see any questions yet. So I've been getting some WhatsApps from people saying they like you. And then but I just want to encourage the audience to use your Q&A facility there and pose questions. So today I want you to be, there must be a bit more, we must be relaxed because we're here to talk about these things. A lot of issues have been raised here, starting from Satish, you helped us by giving us a structure, which I mentioned that a lot of actuaries and I'm sure even other professionals can relate. But in terms of actuaries and actuarial students and so on, I'm not sure if we have any of our honors students here from UCT who know about the actuarial control cycle. I think we speak about it even from first year. It's the approach that that is used in public policy. I think the one part where you say developing solutions, you then had implementation. We would look at it as sort of one step, but it's good that actually one looks at it as a different step. And when I listened to you, Tsepiso, you were dealing with the issues at various levels. So you identified an issue at the problem specification stage. Like, what is the problem? And many people have different ideas of what the problem is. So if you get it wrong there, you already have a very bad foundation there. And then there's the issue of developing solutions, which would be a form of a policy. And in all of the sort of, how can I put it? If you have the wrong people doing that, involved in that process, or you have got politics that doesn't consider certain things and only consider certain other things, then you will have mistakes there in just defining or developing that solution. And then you have the implementation issues. If you just don't have the right people, or you've got influence of politics again in the implementation, and then you're going to have very poor outcomes, not because the policy is bad, not because the problem was not well understood, but just because there's poor implementation. And I think South Africa, we are known for that. I think we spoke about the police station that is not built. The funds are there. The problem is clearly there. There's a police station that is burnt. You don't need a scientist to tell you. You don't need to go to the University of Stellenbosch to figure that out. But then implementation is a problem, which could be the politics happening in that area, that, you know, this tender has to go to that one or that one or that one, and so on. And Satish, you spoke a lot about you even spoke about organized crime, which we see. So there are many issues. So I've now seen some questions. I was just rambling a bit to make sure we get some questions. So first question I see here, it said, is there a case to be made for policy to be less complex so that it can be understood and implemented easier? So you can both have a take on this, Satish, Tsepiso.
Thank you. If I may have the first bite, I need to leave, unfortunately, good people, at about 3 minutes before 10. So please excuse me for that. It was prior.
Let me do this, Satish. Let me ask all the questions then. Then you'll see
Okay.
which ones to answer. Okay. What is the second question, what is the biggest struggle you have experienced in your job? What would you like government to assist most in our country, national and local? I'm not sure if that question is clear enough. The second part of it is not as clear to me. And then Megan asked, thank you for a really interesting first panel. Could you please make, okay, that is a more, I think they would be, okay, just to make the slides available, we will. And then Sarah says, very interesting foundational points raised. How much on policy is currently included in the actuarial syllabus? So that is more for us. So I think you can tackle the ones that that you are able to do so, and then Tsepiso.
Okay, so thank you for those questions. Very interesting. The first thing, I just want to emphasize a point that colleague Tsepiso is making. Where you woke up this morning, the quality of the air that you breathe, the water quality that you used for your purposes of getting ready for the day, the environment outside of you, all of this is influenced by local government. So if there's any guidance one would want to give the colleagues on the platform, target local government, because the problems are too many and you can't focus all over. The guidance I would give you is that if you wish to make an intervention, make contact with the Minister of Local Government, make contact with the Portfolio Committee, make contact with the South African Local Government Association, if you so desire, and say, we would like to add our expertise in resolving the country's problems, and you find a way to engage each other. So can you make policy easier? Well, you can dumb it down, but the critical issue is that let's take unemployment, let's take poverty. Those are given problems of our country. The issue is, what are the policy interventions that we need to make to fix that? Now, that's at the national level. So some people say minimum wage is a problem and that's why people are not being employed. But there are so many countries around the world that have adopted minimum wages, Britain, the Scandinavian countries, etc. So are we asking the right question and are we getting the right solution? So I'm going to leave it there in a nutshell. My advice to you, good people, is that if you focus on local government, you do a proper stakeholder analysis and stakeholder management policy to guide your activities and your contribution, you could make an unusual contribution to the progress and future of this country. I leave it there.
Thank you very much. Tsepiso?
The policy, I think, in its very nature can be complex. I think it's its interpretation thereof that you would make it, that you could simplify it for yourself. Just like my colleague said, it's the implementing of it, and how you decide together to then say we're going to implement it. I think what is important is consistency. You know, once employees or government officials or government in itself decides that this is the direction that we are going to take to implement this policy, it needs to stick to it. The reality and fact of the matter is that we're not going to please everybody. We're all different. And if we are always trying to please everybody in addressing a particular problem, you're always going to be facing that problem because then you're distracted. So stick to it so that you can ensure a particular outcome. Once you're done, then you can move to the next. But you find that you'll start something and you'll start a process, but because there's going to be this group nyering this side and another group nyering this side, eventually you just stop. And nothing happens afterwards. There's no movement that happens. So consistency and ensuring that you stick to your decision makes things much, much easier. The biggest struggle I've experienced in my job, hostility. I know it all. Somebody, when you have people who tell you that I have it and I know it all, and this is I'm the power monger. Politicians are a huge problem. Politicians are a huge problem. Sorry, Satish. They're a huge problem because they believe that they are the decision makers, and because they've got this power that they have in terms of the position that they have, and therefore they start dictating. That is a problem. And once people, commoners, and I decide I say commoners as in all citizens, because then you have commoners and you have politicians. Once we, just like we have done now with these elections, create a message to politicians that you receive the mandate from us, you don't make that mandate. It's not politicians that make the mandate. It is the people that decide on that mandate. So when we're able to assert that and affirm that through knowing our own rights, I think then it's a step it's a step in the positive direction. Because then we are the ones that, as people, we need to also understand our own values and our own beliefs. We need to ensure that we understand what our Constitution means to us, not at a surface level, but in all its instance. We need to understand what our laws actually imply to us and what it means, so that when we apply them, when we act on it, we act on it informed. What we're currently finding is that a lot of times our people are misinformed. And that becomes a general issue with policy, because politicians, they serve their interests. They serve their own agendas and their own mandates. So it's easy for a politician to manipulate a particular legislation to suit their agenda. And we need to be very conscious of that. We can say there's something wrong with it, but we need to also understand that that's the nature of politics. Politicians are competing for power. And we as people need to understand that in their endeavor to compete for power, they are always going to come back and manipulate something to get your vote and get your power as a share to increase their power. So yeah, I think that should answer some of your questions.
We learned a word here, nyara nyari. So interesting word that you are teaching us. This is very educational. So we have to figure out what nyara nyari means. There was a question around public engagement. Let me just read it. Solving the problems relevant to communities requires some sort of community survey without adding to the problem of elongation. Can this be mitigated using public hearing beyond the initial stage? I think some of us would have the experience that public hearings can sometimes tend to be a bit of a tick box. But Satish, maybe your last shot. I mean, you've got a minute and you need to step off.
So again, once more going to local government, and colleague Tsepiso says it's important for South Africans to understand the law. Firstly, very often when I ask people, have you read the Constitution? Very few hands go up in the room. Now you look at local government, it has brilliant democratic provisions for community participation. One, the budget at the local level cannot be passed without community participation. Two, the issues of LED, local economic development, forms part of a bigger pack, which is called the Integrated Development Plan. And I can tell you, good people, that consultants cut and paste and give this to municipalities, and it becomes the order of the day. Your marching orders at local government is an integrated development plan, which is supposed to be composed every 5 years from the time that the local government is elected in power. And there are obligations in terms of the Systems Act and Structures Act that apply to municipalities, compelling politicians to come and consult with us. Please read the legislation, hold them accountable. Tsepiso, I left politics for those very reasons. It was not serving the greater good. I leave it there.
Yeah. Me and colleague Satish, we report to politicians, but we tell them what we think. That's all.
Look, it's very important. It's very important that that does happen because, and that's part of the assertion, because a lot of our public employees, our public servants, actually have that challenge, their inability to assert themselves to politicians because of fear of losing their jobs. So it does become important because, when you are being threatened with your job, and therefore you can't, you choose to leave out certain things, it becomes a challenge because then it hinders progress. We rely heavily on public servants to do their job. So if a public servant is going to do their job according to what a politician deems is necessary, and it is not, it is actually out, it steers off the course of what it is required, then we've got a problem, we've got a national problem. And that's why we're saying we need to be able to equip our public servants. We need to find a way of empowering them to say, as society, we're going to defend you as well, as long as it's within the confines of the law. And as long as you understand the law and the decision that you have made is within the law, then we will be there and we will support you. But it's not there. We're all operating in silos. And I think that becomes the general issue that you see taking place. I mean, we have just a quick one. We have an IGR, intergovernmental relations, that is supposed to cut across local, district, provincial, and national government. But it's you don't see it happening. It's as if, all departments are operating on their own. And we need to find a way of saying, how do we ensure that we strengthen intergovernmental relations? Because if I have to hold local government accountable on a matter that is related to business development or social development, it means when I hold that department accountable, I am in actual fact holding the Department of Social Development. But that doesn't happen. And those are some of the things that we, as within our different professions, that actuaries itself can actually have that power and tool to say, we need to see consistency throughout government in terms of particular areas of delivery.
You're calling for more activism, and
Yes.
you're calling for us to hold government accountable. You're calling for the state to be professionalized. Satish, you mentioned earlier that there was a point in time where the state's capacity was hollowed out. I don't want to ask you when that happened and whether it's still happening, but our colleagues out there might be aware of some of the things that have happened in the past. But Satish, I can release you at this point, just to thank you for the time that you spent with us, educating us. I think there's an appreciation for the kind of work and your slides. People want, and did you, the slide that you shared with us, that main one, did you create that, or does that come from somewhere? Is it something we need to reference when you use?
Yes, you will have to reference. It comes from a book called The Public Policy Analysis from William N. Dunn. But outside of here, we will then exchange
Okay.
to make sure that we do what is ethically correct in terms of
All
this.
right.
Yeah.
Okay.
Thank you for the opportunity. I wish you well. And one of the things that I wish to say as a nation builder, thank you for rising to the occasion of wanting to make a positive contribution to our country. We outsource our lives to the politicians. Tsepiso is correct. Let's take it back. We should not outsource our future. And thank you, everyone, and a wonderful conference ahead. Bye-bye.
Thank you, Satish. Thank you. And Tsepiso, also thank you very much for your contribution. Any last words from you, Tsepiso?
Thank you so much for this opportunity. I really appreciate the chance to be able to share with you my own experiences. It's quite interesting to have done it in a crunch time, but I do appreciate it. And it's a call out for actuaries as well. You play a vital role within this space, and I'd like to encourage you to continue to do so. Don't be afraid to reach out to the communities. You will learn a lot from just people walking out in the streets, and it will give you an idea of what people are actually thinking. To just sit at a bus stop and just start a conversation. I know it's not always easy, it takes a particular character and personality, but you'll be so surprised in terms of what information comes out of people with that. Yes, we'd want to do surveys and all of that, but there's a lot more when you hear people talking and sharing with you from a heart to heart. So well done on this conference. I hope that you do learn a lot and you get a chance to engage, but revive that activism inside of you because it's there. I'm not saying leave your job. Within your job, be an activist. Thank you so much.
Thank you. So typically you're saying I must organize the actuaries and we must go into the townships. Thank you for suggesting that.
Yes, by all means.
Well, I'll take them with to my village in Limpopo.
No problem.
Okay. Hey.
You're welcome. Welcome.
Thank you very much. Thank you. Thank you. Okay. Now we are going to another very hot topic. And the speaker has joined us. Prof. Stan, you can switch on your video. Are you there, Stan?
I'm here, Lusani, but the video doesn't turn on. Let me go out. I'll go out and I'll come back in.
Because I saw it when you came in. So...
There we go. Now it's on. Okay.
All right.
Great.
Ladies and gentlemen, this is Prof. Stan du Plessis. He doesn't know that I knew him before he knew me. When I was a student in Stellenbosch in around 2001 and so on. He was still looking a bit younger than he does now. And a lot leaner. So, but he occupies a very important position. Him and I have had several conversations with Andrew Leroux as well, looking at issues of education funding. We come together once in a while to discuss those issues. I've had the privilege of serving on a couple of Department of Higher Education task teams looking at some of these matters. Stan has helped me to understand some of those issues. So I've asked him to come here today and actually present to us some of the challenges that universities are facing. We know that as an actuarial society, we source our skills and our next actuaries from the universities. I happen to work at a university as well, so universities are very important in our lives. And a lot of the policy issues that we were talking about in the last presentation, you need the university guys to come and assist you with understanding, unpacking those issues, and even implementation. So universities are very important in our lives. Stan, over to you. I'm not sure if you are able to drive your own presentation or whether Erin will assist you with that.
Let's see if it works.
Over to you. Okay. It's working.
Is it working? It's live?
Yeah.
Very good.
Yeah.
Thank you very much, Lusani. Thanks for the kind introduction as well and for this opportunity to talk to the ASSA colleagues. I'm here to talk about funding and financial sustainability for higher education in the public sector in South Africa. And it's not just a South African discussion. So you're aware of the fact that universities are under financial pressure internationally too, but also locally. And I want to start with a very concrete example, the one that I know best, which is the Stellenbosch example. I'm partly responsible. As COO, I'm responsible for the university's finances together with our finance division. And when we started the budget projections last year at about this time, and we always project over a 6-year horizon, we projected a cumulative 1.4 billion rand deficit for Stellenbosch University over a 6-year period. Now, Stellenbosch is, in the South African context, a comparatively well-resourced university, but we would not have been able to absorb 1.4 billion rands worth of losses over a 6-year horizon. And so that was not a viable path for us. Now, we took some strong decisions, reprioritized, we cut the budget very sharply. I think you also know that some of our sister institutions have not been able to make those same budget cuts in that period, and they are facing some significant losses this year, and they will now have to make the same decisions. Otherwise, they face cumulative losses that will also overwhelm their reserves. So for us, the problem now is very concrete. It's not just a theoretical discussion about potential financial sustainability questions. It is actually right here and now. We have to take strong decisions right now. Otherwise, these institutions risk going under. Now, it's not, as I mentioned to you, it's not just a South African discussion, and there's a reason behind it. And one of the important reasons behind it is that the business model of a modern, especially research-intensive university, is a particularly problematic model. What happened in the course of the 20th century, and this is in the words of Christensen and Ehring in a book that I really like called The Innovative University. Christensen was based at the Harvard Business School for many decades. In their telling of the story, which I agree with, in the course of the 20th century, what happened at research-intensive universities is we have plugged what they call a German-style university for graduate students, or a research institute, on top of an English-style college for undergraduate students. So you have really two fundamentally different enterprises operating under a single corporate roof. And as a consequence, your financial management and your ability to see the cost structure of either of these two enterprises is severely compromised. I can assure you that from my own position, that is also clear. If you think of the facilities of a university like Stellenbosch that we make available to our academics, it is nearly impossible to determine when these are being used as part of our research institute, or whether it's used as part of our learning and teaching institute. And that does mean that financial planning and management is all but impossible, especially because the research side of the university also requires subsidization. So the research institute at a university almost never breaks even. And that's not a particular criticism of the research side at South African universities. That's also true at international universities. In fact, it's more true at international universities. Let me show you the situation at Harvard, for example. So if you think of the Harvard annual budget, then the recurring revenue of Harvard pays for only 55% of the, 55% of the annual expenses, the recurring expenses of Harvard. 45% of their annual operating expenses is paid for either directly from their endowment or from gifts for current usage. So they get current donations, and then they have a $54 billion endowment, and they take the rest of their budget from their $54 billion endowment. That's worth knowing, because if it wasn't for their $54 billion endowment, Harvard could not operate the business they currently have. Their current revenue is nowhere near sufficient to operate the system that they've designed in the course of the 20th century. And it's the same with Oxford. If you look at the Oxford example, here's their retiring VC last year, and she told the Financial Times, we lose money on every student, and we lose money on almost every research tranche that we take. And of course, they can do it because they had 900 years of wealth accumulation behind that. If it wasn't for that, they couldn't do it. And there's something else to realize, is both Harvard and Oxford are severely limited in scale because of these financial constraints. So I don't think we always appreciate the fact that Harvard and Oxford are about 2/3 as large as Stellenbosch University in terms of student size. So despite their tremendous resources, they serve a student body that is not even as large as a medium-sized university like Stellenbosch. Let me now talk about the financial risks specific to South African universities. So the first is, in fact, our economy. We've been operating in a stagnant economy, and I'm going to say something about that in a moment. Our biggest funder, at least up to date, was government, and they are in very serious fiscal difficulties. In addition to that, a national financial aid scheme was launched that was both poorly designed and badly implemented. At the universities, there has been an alarming cost escalation, and the consequence of this has been rising student fees, as well as concerns over fee regulation. So let me start with the economy. The South African economy has faced essentially 17 years of stagnation. The GDP per capita on an inflation-adjusted basis is at the same level as it was before the international financial crisis of 2008. That means we've lost 17 years of progress. That's not an automatic result for our economy. In the period 1994 until 2007, our economy grew ever more strongly. So our economy has the inherent dynamism to be able to grow in real terms and to increase the real resources on a per capita basis. But we haven't seen that over the course of the last 17 years. So that is a tremendous setback for the average household in South Africa. And as you know, when I use a word like the average household in South Africa, that's already a problematic concept due to the high level of income and wealth inequality in the country. The average household is a deceptive term. Most South Africans do worse than the average household if you take the average household as a mean and not as a median. Now let us maybe put our sector in international comparison, because there is a question as to whether we need to provide more resources to higher education in South Africa. And what I do on this chart is just to give you a feel for how these numbers play out. On the x-axis, I've got the proportion that is spent on higher education as a share of GDP. So if you look at the dot that I've marked in blue, the United States, in the United States, it's an expensive higher education system. And so they are to the right on the x-axis. Now on the y-axis, I have a proxy for the outcome of higher education in the proportion of the population that has earned a higher education qualification of some sort. So you would expect that if you invest more in higher education, on the whole, you would get more. So there is a very rough positive correlation on the graph. But again, if you look at the United States, even though they are high on the y-axis, they do so at considerable expense. So they spend a lot to achieve the outcome that they get. And I've marked the OECD average for developed countries with the dark dot in the middle of that cross plot that you see there. So where is South Africa on this chart? And let me show you. So South Africa is the red dot. And this is if I only take the direct subsidy to universities. So if I say resources available to university, is that part that government spends through its budget on subsidizing the universities. Then you can see we are in the lower half of the distribution on the y-axis, but really the most striking aspect is that we are the lowest single dot for which we have reliable data on the y-axis. So the system doesn't perform particularly well, but the graph is not the whole picture. What I'm now going to do is I'm going to add the amount that government spends on NSFAS, on the National Student Financial Aid Scheme, which is also public resources spent exclusively in universities via student fees, for example. So this is part of the total resource envelope for South African universities. So if I do that, then you see we have a very striking outcome. If we combine subsidy and NSFAS, then the South African higher education system is one of the better resourced systems, relatively speaking, in the world. The problem is not on the x-axis. The problem is on the y-axis. The problem is the output of the system, given the considerable resources that we are spending within the system. And that tells you that we are spending these resources comparatively poorly. And then there are specific pressures. I'm gonna move on from that. So for us, from a university perspective, we face the following challenges. So for a start, we can't decide how many students we enroll. We have an enrollment plan with government. We can't expand beyond that, even if we have more capacity, or if our system can, in principle, scale better. We can't scale. At Stellenbosch, we can only take 5,500 new first years every year, but there's no rational suggestion that that is the optimal amount of first years that we can accommodate. Government subsidy per student has been declining. It's been declining to such an extent that next year will be the first year in the history of Stellenbosch University that student fees will be a larger part of our budget than the government subsidy. If we had this discussion 30 years ago, government subsidy was 90% of our budget. From next year, student fees will be larger than government subsidy within our budget. That tells you how big an inversion has occurred over the course of the last 30 years. And we face the looming threat of fee regulation. So let me just stop there for a moment and make clear to you how devastating that's going to be for financial management at universities. So we don't control quantity, the number of students. We don't control subsidy, and subsidy has been declining. And if our fees are regulated, in other words, if our fees are determined in Pretoria, then we will have neither control over price nor quantity. And remember, I said the research side of the university doesn't break even. So you can't bail out the teaching and learning side that I've described here from the Research Institute. In fact, it's the other way around. And so we would be left entirely without the parameters to manage the universities financially independently if our fees are actually regulated, given the other parameters that I've described for you here. Meanwhile, our costs have escalated. Together with the rest of the public sector, our costs have escalated sharply. And as a consequence, university balanced this budget dilemma by raising fees. Now, this is not surprising. Other universities have done it internationally as well. It's beautifully described by Christensen and Eyring, and not in a flattering way. They say the crisis in today's universities is real, and much of it is of the university's own making. In the spirit of honoring tradition, universities hang on to past practices to the point of imperiling their futures. When reduced budgets force them to cut costs, they trim but rarely make hard trade-offs. Paradoxically, they respond to economic downturn by raising prices. From a market competition standpoint, it is slow institutional suicide. I already mentioned to you that many of the South African universities did not do what we did last year, which was to do very sharp reprioritization and deep budget cuts. And that is exactly what Christensen and Eyring is concerned with, and I think rightly so. This leads to what economists call the cost disease in higher education. On this chart, I show all the subcomponents of the consumer price index since the beginning of the century in South Africa. The horizontal dark line in the middle is the average. So that's the CPI that is reported as the proxy for consumer inflation in the country. So all the lines above it are components of CPI that experienced a relative price rise compared to the rest. And the components below it, and the lowest one is clothing and footwear, are components that had comparatively lower price rises. In other words, they became comparatively cheaper in comparison with the rest of the consumption basket. Higher education is marked in red. So we are in the upper part of the distribution. We became more expensive. The very top line is, of course, tobacco, which government actively tries to tax out of our pockets. But universities themselves made the decision to price ourselves in the upper part of the consumer basket. And that means that we've become ever more expensive. By the way, schools are even higher than universities on this. And it's not just the independent schools, it's public schools as well. This is an indication from an economic history paper that tells you how much more expensive universities have become. The data is already a decade old. All that has happened is that the trend has continued that you've seen here subsequently. But this was done by my colleagues Johan Fourie and Estienne Karlitz. And this is the cost of a BA degree at Stellenbosch University from 1911 onwards, expressed in inflation-adjusted terms. And then divided on this chart by the median income in the country. So the black line tells you how much more expensive in real terms the BA degree became. The red line tells you that at least until the 1960s, household incomes grew faster than the adjusted real price of the BA degree. So the BA degree became relatively more affordable compared to your household resources. Since the 1960s, it's gone the other way. And this century, it has accelerated so that we now have, by the middle of the third decade of the century, we have a degree that is as expensive as it was in the pre-First World War era, when higher education was an extremely inaccessible opportunity within South Africa. That led, of course, to the crisis in higher education of the last 10 years, which led to the introduction of the NSFAS scheme. You're all familiar with the background to that. You're familiar with the Year Commission's report of late 2017, and also with the fact that government set that aside and nevertheless introduced a NSFAS scheme that was poorly designed and poorly implemented. I am opposed to fee-free education. I'm not opposed to providing financial access to poor and working class students. We must do it, but there must be a balance and there must be a burden sharing between the student and the rest of society. To make it simply fee-free is both economically irrational, because the major benefit of the education opportunity goes to a private individual that is funded from the tax of all South Africans, most of whom who did not have that opportunity. So it's both morally wrong and it's economically irrational to put the burden entirely on society, whilst the benefits accrue mainly to the private individual. And that is why within the South African budget, the expenditure on tertiary education is the only part of the social budget that makes our country more unequal. So this is a chart from my colleague Sir Fas van der Berg's work in the economics of education. The components of the budget that lie above the horizontal line here increases income inequality in the country. So when we spend on child support grant, we lower income inequality. But when we subsidize universities, because of the private benefit of university education, we inadvertently make the country more unequal. I'm not arguing against funding universities. Please don't misunderstand me. I'm just saying we need to be cognizant of the consequence thereof. That's one of the reasons we should not think of this as a fee-free exercise. And then there are various problems with the NSFAS scheme. It's poorly designed. It has a hard edge at 350,000 Rand. It has not been adjusted for the last 8 years. And it has swallowed up the bulk of the higher education budget, so that by now government spends considerably more on NSFAS than on the university sector, and still the budget is unsustainable. So reactive measures have been taken, like capping the accommodation part of NSFAS, capping the food budget. So we have thousands of NSFAS students who have run out of food quota and who can't afford their accommodation, even though they've been told that they have a comprehensive bursary to study at public universities, a dream which is not realized. And then for reasons of inflationary consequence, they are often defunded in the course of their studies. So the system really functions very poorly, and we have to do better than that. So I'm going to stop there. Lusani, I have some suggested solutions, but why don't we first hear from the audience?
Yeah, Megan has spoiled us here. She has asked a question. She's saying that in your graphs, you were talking only about the traditional academic universities.
Yes.
Were universities of technology included? And what about other post-school training? And would the picture improve if we directed more budget to vocational training and apprenticeships? Or do we need to direct to the school system, basically? Yeah, that's the first question. If it's okay, I can read the next one. This is from Roseanne Harris. Thank you for such a clear presentation identifying real and critical challenges. By the way, Roseanne Harris is a past president as well as the past president of the International Actuarial Association. So a very big person. Thank you for such a clear presentation identifying real and critical challenges for our higher education in SA. Is the percent of GDP measurement a realistic measure to compare resourcing? Should this not be considered as a financial amount on a PPP, triple P basis? What is that again? Purchasing power parity.
Purchasing power parity.
I only take that from Economics 1. That's all I did. Basis to be a fair comparison when considering much wealthier countries in terms of GDP per capita. I think you can tackle those two. Those are the only two we have so far.
Sure.
Yeah.
I'm happy to do so. So my data included all universities, including universities of technology, but did not include the TVET colleges. So they are funded separately in the budget. And so it's not the whole post-school system. It's the university part of the post-school system. The question from Megan about whether we need to fund other parts of the total education system better, it's a difficult question. I think the point that I want to make simply is the case for universities is it's not obvious that we are underfunded. That's the first point, is we face financial difficulties, but it's not obvious that the part of the national budget that's allocated to higher education is too small. It is, in fact, a comparatively generous amount of the national budget. That's just the point, and I will address Roseanne's question about that in a moment. The problem at the school system at K1 through 12 is not all and my colleague Sir Fast that I mentioned and his group here are our specialists in the economics of the school system. Their research tells us that the problem there is also not primarily resources. The main problem there is the efficient use of those resources. So the school system is also not on an international comparison underfunded, but we have a tremendous diversity in the efficiency with which it is used. And in fact, the outcomes in about 40% of the school system are entirely catastrophic. Even here in Stellenbosch, we have a high school 5 kilometers from me that had 99 matriculants last year, of which only 4 passed with a bachelor pass. I think it's a scandalous outcome. Now, you might ask, so this is not a school that is a long way from centers that could provide support. It is not an underfunded school, though it is in a comparatively poor community. But it is a school that, from a management perspective, malfunctions. There is barely any time spent on the actual teaching of the children. They are barely ever in class. So it is a malfunctioning system. It is to an important degree not really a school. It looks like a school from the outside, from the building perspective. It does not function like a school. And so that's not in the first instance a financial matter. It's a management matter. It's a very hard matter to address. I don't have easy answers on it, but the answer does not lie in throwing more money at a school like that. To Roseanne's question, her intuition is right that 3% or that 1.4% of GDP in South Africa is a different quantum from 1.4%, for example, in France. I mean, that's absolutely clear. The reason why it's a useful comparison to use GDP is because we are talking here about the resources that the government make available to higher education. And in fact, all governments' financial scope is a function of GDP. So GDP is a useful proxy for the tax base. There is no country in the world that has a tax base, if you exclude the welfare state component, much larger than 30% of GDP. So France has a budget that's much larger, but that's because they've got the public pension scheme on top of it and the health system on top of it. But if you exclude what I'm going to call the welfare state component, the part that's available for the utilities of government is at most about 30% of GDP. And as you know, the South African budget is about 30% of GDP. So we almost have the budget of a developed country. So to ask what part of our GDP we spend on higher education is to compare us reasonably with the resources that one could allocate to a priority like higher education. So the graph is meant to indicate to you that within our total prioritization, we have not deprioritized education. We have allocated as much as one could reasonably expect, given the other claims on our budget. And in our case, it is. I mean, it's 100 billion rand in our budget that's allocated to higher education, and you can express it in those absolute terms as well. It would be very hard to make the case in the South African context that 100 billion rand this year is an underfunding of the university system. In fact, it is sharply more than 10 years ago, relative to the rest of the budget as well. So that's why. So you can express it differently, and I'm happy to redo the chart in the way that Roseanne suggests, that we do this on simply a PPP adjusted per capita basis, for example. But the message is going to be quite similar: is that the South African higher education system is not underfunded, but the results are poor. We don't get much bang for our buck.
I want to focus on that point, because I know that you're probably one of the few people, if not the only person, who makes that point, that actually we are not the high, I should say we are not, but the higher education sector is not necessarily underfunded. Other colleagues of yours may have a different view. Is that the case? Do other colleagues have a different view on
Yes.
that?
They do have a different view. They have, because they look. So if where you look is only the subsidy that government gives us per student, and you observe that the subsidy has been declining, then I can understand why you would say we are being underfunded. And in fact, that's exactly what the previous minister used to say. So when we met with Minister Nzimande, he would always say, you know, the system is underfunded, subsidy has fallen behind inflation, and in the last year actually declined in absolute terms. And so that was his metric. He says Treasury is squeezing us, there's austerity, the system is underfunded. But he preferred not to look at the fact that a big part of his budget is spent on NSFAS, and in fact, since the last 2 years, more of the budget has been spent on NSFAS than on the universities. And that is from the Treasury perspective. So if I put a Treasury hat on, who have to do the allocation across all the priorities of government, then Treasury will say, no, we've given you 100 billion. We have sharply increased the total higher education budget over the course of the last 10 years. And as a university sector, we have to realize that, because remember, the NSFAS budget is only spent within universities. It's spent nowhere else. It is absolutely part of the resources that flow to universities.
You said you have got some solutions, because in a sense you're saying my employer, I don't know if I'm conflicted, that you know that model is not efficient. So how can it be made efficient, according to you?
Right. So the first part of the solution is we can't continue with spending ever increasing amounts on a poorly designed scheme that does not actually work for our poor and working class students. So it's perverse. It's perverse for us to allocate this year 54 billion rand on a scheme that in fact does not provide full access bursaries to our poor students, does not even provide food. So at Stellenbosch, we are now giving 1 free meal per day for our students on weekdays for the NSFAS students because their food quota has run out by the end of June. So if that's the situation, then even the 54 billion is clearly not working. We have to step back and say, how can we take the generous amount of funding that's provided for student access and make that go the whole way? Now, you can only do that if you provide a rebalancing of the responsibility between the student and society. In other words, that the student will have to have some obligation in future to repay a part of what society has spent on it. The idea that we can simply pick up the bill in the budget has been demonstrated to be false. By the way, it's sad that we had to demonstrate it because the Year Commission told us that in 2017. They told us you will not be able to afford it. And now we've run the experiment, and after 8 years, we can see that we can't afford it. But that wasn't deep science. It was completely clear from the start that we would not be able to afford it. So that's the first thing, is we have to stop wasting money, spending it inefficiently through the NSFAS system. That's harming the entire system. The entire sustainability of the system is threatened by this poorly designed scheme. So that's the first thing that we need to resolve. Then I think we as universities need to decide what the agenda is that we actually wish to pursue. And when we talk about international rankings, for example, we are being compared on a scale at which the anchor points are Harvard and Oxford. And what the rankings do is, through a methodology that's not particularly attractive, they measure the degree to which you look like Harvard. So if you have, like Oxford or Harvard or Cambridge, a ratio of 1 student per lecturer, that is counted as the gold standard. And if your ratio of students to staff rise, for example, because you're able to serve your students more efficiently using technology, the only consequence of that efficiency will be that you will decline on the international rankings because you will look less like Harvard and Cambridge. Now, I think that is a perverse outcome. Normally in an industry, and in any of the industries in which you work, if you gain in efficiency, that's a plus. You get rewarded. We think you are doing better as a sector because you are using your resources more effectively. The way the rankings work in higher education, we get punished. If we find ways of working more efficiently, of serving more students with the same resources, we simply decline on an international comparison. I think that's because we're taking the wrong agenda. Our agenda should not be to look as much like Harvard as possible. I've shown you the financial numbers from Harvard. So Harvard's model only works because they've got a $54 billion endowment. We haven't got that. So in purchasing power parity terms, which is the comparison that Roseanne asked for, Stellenbosch University has an endowment of $65,000. That's the highest in South Africa per full-time equivalent student. Harvard has $2.2 million on the same comparison. So we cannot be compared with them on a realistic basis. And to take our agenda from a system that makes us look like them or rates our excellence in comparison with the extent to which we operate like them is just the wrong way of setting our agenda. So I think we need to set our agenda differently. We need to understand the context within which we work. We need to think of that y-axis in my graph and ask ourselves, how can we stretch the considerable resources in South Africa for higher education to get much higher on the y-axis and not care so much about whether that makes us go from 200 to 300 or 400 on the Times Higher Education ranking.
So there are a couple more questions here. So there's an attendee who's asking, seeing that many irrational decisions are made by politicians and now the NSFAS crowd, what value does logic and rational actuaries bring to the table? So that is one.
Yeah.
So you're loving that. And
I
then
love that.
Greg asks, to what extent do South African universities charge higher fees for certain programs like medicine that are more expensive to deliver but lead to higher paying careers, and while keeping fees low for fields like humanities? Yeah,
Right.
those are the two
Okay.
questions.
So the first is, I think there's a tremendous role for actuaries, and that's why, Lusani, I appreciate our discussions so much, and I'm very glad that you're also involved in the national discussion around university funding and policy. You bring exactly what we require. We need a reality check, and we need some sound financial modeling in these decisions. That's precisely what wasn't done with the NSFAS scheme. If the NSFAS scheme was tested with a group of actuaries, we would never have launched it. So I'm begging you to be involved in this discussion. You bring a skill which almost no other group of professionals can bring to this discussion. So I would be really very pleased if you could get involved, either at individual universities or at the sectoral level as you are involved.
Stan, there's a risk that our contribution might be labeled as not progressive, if by the sounds of what
you can join me on that. So my
we join the
contribution
club.
my contribution is also not labeled as progressive, but you have to also talk back to that. And I use that slide that I showed you when I show you that the expenditure on higher education in the country is not progressive. So let's get over that and realize that in itself we are talking about public expenditure that is not progressive. So how can we improve the impact of it? The way to improve the impact is, in fact, to make that opportunity available to more South Africans, not to fewer. What you're seeing on that chart is because we are reserving access to comparatively few South Africans because of the cap on scale. If we can find larger scale in the South African higher education system, that gray line of mine will go down. So I also want to have a progressive outcome, but you don't get a progressive outcome by having an ever more elite public system. We've seen that over and over again in the developing world, in Brazil, in Uganda, and elsewhere, where the public university becomes a university for the connected and for the elite, and the rest of the population is left with an expensive private system. That's not the answer for us either, and we can do better than that. And that's a progressive agenda. That's not a conservative.
Yeah. You were still tackling the other question.
Yes. So the other one is, South African universities do ask more for medicine than for humanities, but not by any extent relative to the cost of those two degrees. So government subsidy of medicine and health sciences in this country for an MBCHB degree is extremely generous. So the syllabus that we use for medicine and health sciences in South Africa is an extremely expensive syllabus. It's highly clinically intensive. Of course, that means that we have very high quality graduates from MBCHB, high quality in the sense of highly experienced. They've had tremendous clinical exposure, but that clinical exposure is incredibly expensive. So if you think so perhaps the fee for a medical student this year is about 90,000 Rand. Government spends another 350,000 Rand per student on their MBCHB degree. So we are talking about more than 400,000 Rand per MBCHB student is the cost of educating a doctor in South Africa. That is an extremely expensive syllabus. And that is, by the way, why no private university in South Africa can ever provide this, because no private individual will be able to put 500,000 Rand down for this degree. So they might as well go international then.
Cuba it is then.
Sorry?
Cuba.
well, of course, you know, we spend even more tragically on the students we send to Cuba. So the students the South African government sends to Cuba costs us more per year than even the expensive South African system, and they get taught in Spanish. So, I mean, that is a completely perverse waste of public money. So the kind of progressivity that our questioner asked for is not strongly evident in the South African system. We could do more. But I wouldn't suggest that we do it between programs. I would suggest we have a much bigger differentiation in fees for comparatively poor and comparatively wealthy South African students. And that's what happens at Harvard too. So the ticket price per year is $100,000 to study at Harvard, but if you are from a comparatively poor family, they will discount that to zero. So you will essentially have a full bursary at Harvard. But if you're from a billionaire's family, you're going to pay $100,000 per year to study at Harvard. So there's an internal cross-subsidization between the students. I would be very much in favor of that.
Sure. I think we have dealt with all the questions because some of the others, so they were saying, does the same apply to the nursing profession? The thing that you've mentioned around the cost of training a nurse, would it be the same as the
it is not as expensive as MBCHB, but it is an expensive program because you've got clinical time. But it's the most expensive one is MBCHB. Well, actually, the most expensive one, I believe, is veterinary science.
Oh, the animals.
It's even more expensive, but MBCHB is an extremely expensive program.
Sure. Okay, let's wind down now. What do we do? I'm one of the regulators that you're worried about. I'm not quite a regulator yet. I'm just still looking at the framing of that issue of fee regulations. But
Sure.
what's the what must be done? What should actuaries do? What should policymakers do?
Well, the first thing is not to regulate the fees. In the current system, if you regulate our fees, the financial management will be impossible. So you will simply sit with a crisis that the universities will suffer unmanageable losses. So that is a preventable problem. So I'm now saying the same as Judge Heer said at the end of 2017. I said, please don't do it, because if we do it, sure as I sit here, the universities will end up in a financial crisis. Just as Judge Heer said, if we implement fee-free education on the NSFAS model, it will be unsustainable, and that was correct. So that's the first thing. The second thing is we absolutely need to pivot the generous resources for access that we're currently spending on NSFAS into a sustainable model. Now, whether that's a contingent loan or whether it's an income share arrangement, which I favor as opposed to a contingent loan, that we need to do that. We need to provide access for students. So the focus must be on access and burden sharing for poor and working class South African students. And then universities must have a radical program of cost efficiency to provide the high quality higher education, but in our context. In our context means at sufficient scale so that the cost per student is not prohibitive. And that will necessarily mean that we will look worse in comparison with Harvard, and that's fine. That is not a problem. We don't have the $54 billion. We don't have the $2.2 million per student on a purchasing power parity adjustment. So we can't try to look like them, and we are harming the potential good that we can do in the country.
All right, thank you, Stan. We have to wrap it up here. Thank you very much for your contribution. I think we'll find ways to reach out to you. I mean, you and I are always engaging on these issues, and we'll continue to do so. So thank you very much. Thank you very much.
Thank you very much, and have a lovely morning. Goodbye.
All right, thank you. All right. So. Whoa, is this now break time or is it the next one? 10:45. We're starting with the next one. I see Dr. D and Prof. Tom are on the call. Prof. Tom is I mentioned it in the beginning, is a colleague of mine at UCT. Both of them are colleagues of mine at UCT. So now we're counterbalancing the Stellenbosch University dominance in the morning. So we're bringing in a bit of UCT here. I'm both. So I think we are now becoming fairly even. So they are going to be talking to us about demography, actuaries, public policy, and Tom will have will go first, and then Lee will come in after that. Tom, over to you.
Hi, good morning, Lusani, and good morning to this rather interesting session, which has been organized by Lusani, and it's a great honor to be here. For those of you who don't know me, I am based at UCT. I trained as an actuary. I worked at Southern Life, as it was then, for many years before I decided to go into a different career as a demographer. And so what I'm going to be doing today is reflecting on some of the kind of points of intersection which might exist between demography, between actuarial science and public policy. And in the process, I'm going to possibly throw out a couple of challenges to the profession for how they go about thinking about some of these issues. So just to start off, to draw a distinction between two fairly closely related ideas of the discipline of population studies and the discipline of demography. And demographers do draw a distinction between the two. Population studies is the overarching discipline. It's typically located as a field within the social sciences and is quite theoretical. It tries to theorize why and how demographic phenomena change. And the discipline itself is very strongly affected and influenced by other disciplines. Population studies draws particularly on economics, on sociology, from history, from human geography and anthropology, to try and explain why it is the case that certain demographic forces and demographic features change. By contrast, demography, which is a subset of population studies, has been described as the most quantitative of the social sciences. And this field draws far more from the realms of mathematics and mathematical statistics, which of course is far closer to the fundamental training of actuaries. But our focus here as demographers is on the quantification and estimation of fertility, mortality, and migration, the three core factors that drive population change, and to do that through the use of mathematical and statistical models. Now, for much of the second half of the 20th century, the focus of much demographic work was how to do that quantification and estimation with data that are limited, deficient, or defective. In other words, where the data quality are not perfect, one doesn't have the kind of detailed information which, say, the continuing statistical investigation run by the Actuarial Society has, where you can calculate exposed to risk directly, you can calculate mortality rates directly. But we are struggling, in most developing countries, struggle to produce reliable, complete, and directly useful data. And so much of the work of demography is focused on how to go about doing that demographic estimation. And I just want to put it out there that demography, as a result, sits at the meeting point of what C.P. Snow in the 1960s termed the two cultures. He was a British academic who said, the problem with the world is that the scientists and the social scientists, or the people in humanities, have formed two separate tribes, effectively, who don't talk to each other. And that, this was his great lament at the time. However, where demography, I think, sits at the interface of those two cultures is because even if the maths and the stats which we apply to produce estimates of demographic quantities from limited, deficient, and defective data, even if that stems from the more of the hard sciences, the explanation for what you're seeing always lies within that broader field of population studies. If women are having, as your maths tells you, on average 2.4 children each over their lifetime, the reason why they are having 2.4 children each is not because your maths have said so, but because there are social processes in operation in society which are shaping those forces, and likewise with migration or mortality. So in terms of demography and public policy, from one 10-year period to the next, most people do not give more than a passing thought to demography or demographic concerns. Every now and then there are articles in the newspaper about the fact that China's population has started to decline, which is a process which is going to happen for certainly the next 50 to 100 years. You might see newspaper articles about shrinking Italian towns or the crisis of the Italian or Japanese social welfare system. But most people tend not to think much about demography and the concerns and the issues which it raises. I was sitting in the briefly in the session just now from Stan, and one of the things which demography will tell us is that we have already reached peak child, most probably in South Africa. That peak cohort of children was born probably in 2018. They've probably entered school now. That means that by 2037, the largest ever cohort of children will be entering the university system. And what implications might that have for the provision and financing of healthcare? Of course, other things might change. The education system for primary school and secondary school might change, but there's an ineluctable demographic force there, which tells us what the future might look like and might affect how we think about questions such as higher education funding. But within that a definition of demography, the scientific study of population structure and dynamics, as I've said, our crucial focus is on measuring those demographic events from limited, deficient, and defective data to understand the contributions of each of those three major components in shaping that structure and change. Have we reached peak child because of declining fertility, or is it changing patterns of mortality? Those kind of questions. And also to tie those three aspects of population change into a coherent set of population projections, such as how we know that we've probably reached peak child in South Africa. But even though people don't think much about demography, it matters. It matters for developmental planning or infrastructural planning, health, housing, education, social security. And all of those are simply because in an environment with limited resources, once ideally, those decisions on development, infrastructure, health, housing, education, social security, to be informed by evidence. And that means we need to understand, where the people are, where they might be moving to, what are the future trajectories of the population. If one's interested in old age security, one wants to know how many old age people there will be in the country in 50, 60 years. And crucially, also in South Africa and also in some other countries of the world, demography matters because it's the single largest component of what we call the equitable share formula, which is the formula which the National Treasury uses to allocate resources to provinces. Now, there's several components to that formula, but all of them, to some degree, or about 85% of that formula, hinges crucially on various population metrics: number of learners in school, the number of people who might be accessing the healthcare system, the overall population size. And so we need to know those things in order to make sure that resources are effectively and efficiently allocated. And this is an area which demographers at UCT, at the Center for Actuarial Research, have interfaced with over several years since the formation of the center back in the early 2000s. We, in the early years of the center's history, we looked closely with people like Heather McLeod and Alex van den Heerfer at the economics of healthcare financing. We looked at social security in the form of the uptake of disability and child support grants, which is work we did for Treasury and the National Department of Social Development. We have worked very closely with a number of provinces and metros to produce very detailed population projections to help those provinces understand better what their needs might be over a longer term framework of 10, 15, 20, 30, 40 years. But more crucially, where our work has been focused has largely been in the area of health and demographic data directly. And here, staff at the center were very involved with the Medical Research Council of South Africa, starting in the early 2000s, to really try and quantify the impact of HIV and AIDS on mortality in the country. This was, of course, at a time when there was widespread official denial that there was a strong impact of HIV and AIDS on the country's mortality. And there was what was built was what we called a rapid mortality surveillance system, which allowed us to track on an annual basis. That was our definition of rapid then, but using data collected monthly from the Department of Home Affairs to try and elucidate what the impact of HIV and AIDS was on the population of the country. We've also, as demographers, worked very closely historically. I'll talk a little bit more about more recent events just now with Stats SA on working with the 1996, 2001, and 2011 censuses to help them before the release of the data to ensure that those data are as fit for purpose as possible, and to address any concerns which might have been raised about those data. We also worked with them on the other two major data sets which have been released in South Africa, the 2016 and the 2007 community survey data, where we helped to basically recalibrate the results of those surveys, again, to be nationally representative, and so they could inform policy. Those two community surveys are roughly 1% samples of the entire South African population and allow fairly detailed estimates of population dynamics at a metropolitan level and a municipal level to be derived. We've also worked closely with the MRC and other government agencies, Stats SA and the Department of Health, in analyzing the data from the two South African demographic and health surveys which have been run. And again, those are used to inform public policy about healthcare, about rollout of healthcare, trying to identify needs and gaps in provision, vaccinations, etc. More recently, however, our focus has been very, very heavily on trying to adapt the system which we built in very short time at the start of the COVID pandemic, which allowed us to track South African mortality in near to real time. We were able to produce estimates kind of on a weekly basis with a delay of 9 days from the end point of the previous week, to allow us to understand the emergence of mortality during the successive waves of COVID which hit the country. And this was quite an astonishing achievement. We are the only country pretty much in the developing world which was able to build such a system to track mortality in real time. Again, however, it was interesting that there are parallels back with the original HIV/AIDS denialism of the early 2000s, that for most of the pandemic, the National Department of Health insisted that their estimates of the deaths, which were effectively only those deaths recorded by doctors in hospitals, were the only official estimate of the impact of COVID-19. And only towards the end of the pandemic was there broad-based acceptance that maybe there were other deaths which had occurred. Our estimate of deaths was about 3 times higher than that counted by the Department of Health. Going forward, where we're taking that now is we are still developing that system, still keeping it as a weekly tracking system, although when you report on the deaths monthly. But what we're trying to do now is to interface those data with climate and microspatial data to try and really get a handle on kind of events such as heat waves. We saw in Limpopo at the start of this year that there was a sudden spate of excess deaths, which we can correlate quite closely with a heat wave in that province. We saw something similar in the Northern Cape. And this is something which, as we go forward, in terms of interfacing health, demographic data, planning, and to be able to create an early warning system for emerging mortality events is something which we are working very heavily on. Just to quickly note, other work which we've done also has been on respiratory diseases with the NICD. We have worked very closely with them on the testing data for SARS-CoV-2 during the pandemic. And of course, most recently, Professor Dorrington and myself have been very closely tied in with the commentary on the results of the 2022 South African census, which unfortunately had an undercount of the highest ever recorded or notified to the United Nations of 31%. And we have identified a slew of problems there, which we have expressed grave concerns are going to compromise our ability as a country to plan properly and to efficiently allocate those resources. And we've also been working with the Medical Research Council on the design of other studies which will cast light on the burden of disease and other aspects of health in the country. However, it's probably worth briefly in my last couple of minutes, just reflecting on the connections between demography and actuarial science. And one of my favorite quotes for those of you of a certain age is from a book by Alistair Neil, which was the prescribed textbook for life contingencies, which declared that population, or the study of population, was a branch of actuarial science known as demography. And while that might possibly, arguably have been true 50 years ago, and there were historically significant contributions from actuaries to the development of techniques of mortality estimation and the smoothing and graduation of life tables, the two disciplines have moved quite far apart from each other. Firstly, because actuarial science has only ever been interested in mortality. The discipline's never really expressed an interest in fertility, health data historically, or indeed for migration. Secondly, the evolution of the life assurance and pensions business has fundamentally changed actuarial focus. The move from defined benefit to defined contribution schemes creates less of a need to track mortality. Universal life product designs have tended to pass risk over to clients rather than to companies. And so the focus of actuarial work on mortality has diminished over the last while. But in the meantime, demographers have been proceeding and developing a variety of techniques, including of mortality analysis, that go far, far beyond that of the actuarial canon. So just to close off, some 20 years ago, I co-authored a paper at the ASSA convention written with Guy Thomas, an actuary in the UK, which was ostensibly about the ethics of underwriting. The way we went to in that paper was to note that the actuarial profession is rare as a profession, if not unique, in the sense that most of its members are not self-employed. They are predominantly employed by a single economic sector, the insurance industry of one form or another. And that often and historically, the profession had struggled to articulate a professional view on matters that might be distinct and perhaps at odds with that of the industry. And our paper concluded with a discussion on the necessity for the profession to be seen as contributing to a social good, or what we termed social beneficiation. And we said that the only way that the profession will remain credible and trusted and respected is if it can convince a broader society that it's acting in those interests and not only those of their fundamental and principal employers. And only then would people be able to really appreciate the value that actuaries might be able to add to that work. So to conclude, this is my final slide. Actuaries have very specific and particular expertise in the quantification, evaluation, management of financial risk. And many current debates in the South African public policy arena have very clear and obviously identifiable elements of particularly financial risk. A case in point being the NHI, which you discussed after the break. But other disciplines, demography, for example, or as Lee will talk about now, epidemiological modeling, have developed and have highly specialized skills that may be complementary to those of actuaries. And rather than the profession seeking to develop those non-actuarial skills themselves, or to try and bring them in-house, they should rather be trying to draw on those skills and insights from those other disciplines to render their own analyses more robust. So if you're looking at healthcare or higher education funding, as Stan was suggesting, you might want to consult with demographers about what might be likely to happen with the population of university students entering future cohorts in the years to come. But ultimately, and this is my final point, that for any actuarial engagement with public policy to be impactful, my argument is that the profession has to be able to articulate a view that cannot be dismissed as the mere special pleading on behalf of their dominant employers or their dominant industry. Thank you, Lusani.
Thanks, Tom. Sure. You didn't hold back, eh? You just went for the jugular there. All right. So let's go to Lee. Give me more time to reflect on what Tom has just said. Lee, please.
Sure. Just sharing my slides. I don't know if you can see my screen.
We can see them. I can see them.
Great. I'm going to go into presenter mode. Okay, so thanks, Lusani, for the invitation to present here today. So I'm going to be speaking about epidemiological modeling and how we use it to support health policy and programming in South Africa. This does overlap a little bit with what Tom has been talking about. So when we talk about epidemiological modeling, we're talking about the use of models to estimate the incidence of disease, the number of people living with a disease, and number of people dying from different diseases. Broadly speaking, there are two modeling approaches that are typically used in epidemiological modeling. The one approach is a statistical modeling approach that's applied to death registration data, disease notification data, and prevalence surveys. And the second approach is to use dynamic mathematical modeling calibrated to the same data sources. And the important advantage of the dynamic mathematical modeling approach is that you can make projections into the future. You can evaluate alternative policy scenarios. And for that reason, a lot of the health economic evaluations and a lot of the budgeting forecasts are based on these dynamic mathematical models. And so in this presentation, I'm going to focus mostly on the dynamic models rather than the statistical models, and share a little bit about the work that we've done in South Africa, specifically on the Tembisa model, and I'll briefly mention some of the other models that we've worked on. So Tembisa is an integrated demographic and HIV model that we've developed for South Africa. It was recently extended to include TB as well. It's used by UNAIDS and the South African Department of Health in global reporting of HIV indicators. It's also used in the South African HIV investment case, which is a project to compare the cost effectiveness of different HIV programs and identify what is the optimal budget allocation across these programs. We've developed both national and provincial versions of the Tembisa model. These get annually updated as new data become available. And we also work closely with policymakers to make sure that as we update the model, we are answering the questions that are most relevant to them. Although we don't produce district level outputs from our models, the Tembisa outputs do get used in another model called Naomi, and Naomi is used to produce district level HIV estimates. This table is summarizing the different data sources that we use in calibrating the Tembisa model. I don't want to spend too much time on this, but I think the main point I want to stress here is that there's a large number of different data sources that go into the calibration of the Tembisa model, including survey data, vital registration data, and also data from routine health programs. This next slide is just an example of one of the model validations that we do using the Tembisa model. This slide is showing HIV incidence rates in the 15 to 49 age group. The solid line is the Tembisa estimate, and the dashed lines are the 95% confidence intervals. The dots here are the data from national household surveys. You can see that the model results are roughly consistent with those data, although the 95% confidence intervals around the first three survey estimates are quite wide. And the survey data and the model are both suggesting that there's been a dramatic decline in HIV incidence since the early 2000s in South Africa, driven mainly by increases in condom usage, but also in recent years by increased uptake of antiretroviral treatment, or ART. Our models are also used to track progress towards scaling up different HIV programs in South Africa, and this slide is one example of that. It's showing changes in engagement in HIV care over time. So the different colors here represent the proportions of people living with HIV at different stages in HIV care. The green is representing people who are undiagnosed, and you can see there's been a dramatic decrease in that undiagnosed fraction from the early 2000s down to about 5% currently. The yellow is representing people who've been diagnosed but not started ART. The orange is people who've started ART but are currently interrupting treatment. The red is people who are on treatment but not virologically suppressed, and the dark red is people who are on treatment and virologically suppressed. And you can see there's been tremendous progress made over the last 2 decades in scaling up HIV testing and treatment in South Africa. I mentioned that one of the advantages of the dynamic modeling approach is that we can make projections of the future, and this is one example of that. It's showing changes over time in the number of people living with HIV stratified by age. You can see that early on in the HIV epidemic, a lot of the HIV was in young adults in light blue. But over the last decade or so, we've seen a substantial decline in the number of people living with HIV at those younger ages. In contrast, we've seen steady increases in the number of people living with HIV at older ages. So the red here is representing people age 50 plus living with HIV. By 2040, we're projecting that about 60% of all people living with HIV in South Africa will be over the age of 50. And that's not because the older people are acquiring HIV, it's because of survival of those people who acquired HIV at the younger ages into older adulthood as a result of ART. And this has major implications for our treatment programs. It means that in future, we're going to be treating an increasingly older population of people living with HIV with a lot of comorbidities such as hypertension and diabetes. Here we're looking at the model estimates of deaths in people living with HIV. The red here is representing people who are untreated, and you can see that that number has dropped very dramatically since 2005. The pink is representing AIDS deaths in people who are on ART, and you can see that that's been fairly stable over the last decade. The gray is representing non-AIDS deaths in people living with HIV, and you can see that that has increased substantially over the last decade, largely as a result of the aging phenomenon that I described in the previous slide. You can also see that there was a bit of an uptick in the non-AIDS deaths during 2020 and 2021 as a result of COVID. But importantly, even after COVID, we're still seeing now that more than half of deaths in people living with HIV are due to non-HIV related causes. I mentioned that Tembisa is also a demographic model, and this is showing you an example of one of the demographic outputs. Life expectancy is a standard demographic output. You can see the dramatic drop in life expectancies as a result of AIDS, and then the recovery in life expectancy post 2004 when antiretroviral drugs were introduced in the public sector in South Africa. And then you can see the second dip in life expectancy more recently as a result of COVID. I mentioned that we've also produced provincial versions of the Tembisa model, and this is showing you an example of the outputs of the provincial model. You can see here that the different provinces in South Africa are on very different trajectories. Historically, the highest HIV prevalence provinces were provinces like KwaZulu-Natal in dark red and Mpumalanga in orange, and provinces like Western Cape in dark green and Northern Cape in yellow had the lowest prevalence levels. But you can see that in future, we are expecting a reordering of the different provinces, and that reordering is really a reflection of differences across the provinces in terms of their progress in scaling up HIV prevention and treatment programs. And this is another important use of our models in tracking the relative performance of the different provinces in scaling up these different HIV programs. I mentioned that we've also extended this model to include TB, and this is showing work done recently by Mamapudi Kubjani. She used the TB version of the Tembisa model to assess the impact that the HIV epidemic has had on TB mortality. The black line here is showing our model estimate of the actual TB mortality trend, and the gray line is showing the results from a counterfactual scenario. So here we were trying to say, what would the mortality trend have been in the absence of the HIV epidemic? And you can see from the dramatic difference between the black line and gray line, just how much the HIV epidemic in South Africa has contributed to TB mortality. So all of the outputs that I've been sharing so far have been freely available outputs from our Tembisa website. A lot of people are not aware of the website, so I just wanted to briefly mention it. If you go to the downloads tab on that website, tembisa.org, you'll see various outputs listed, including reports that describe the model, as well as various Excel output files, which include life tables and other demographic outputs that are likely to be of interest to actuaries. And in the last part of this presentation, I just want to include a few examples of other dynamic models that we've developed for South Africa. So we've done some work on other sexually transmitted infections, or STIs. Currently in South Africa, we don't really have a policy on screening for these other STIs. I mean, we have a very well-developed HIV testing program, and we do test for syphilis antenatally, but apart from that, Department of Health doesn't really have any coordinated STI screening policy. So in this study that was led by Rachel Ezra, we were looking at what might be the impact of improved screening for gonorrhea and chlamydia in various different target populations. And the gray bars here are showing you the percentage reductions in chlamydia prevalence that we might expect at a population level if we were to target different populations. And you can see here that we would expect to see the greatest reductions in population level chlamydia if we were to target youth and people in HIV care. We've also done quite a bit of work on modeling cervical cancer. Cervical cancer is important because it's the leading cause of cancer mortality in South African women. So in this work that was led by Kari van Skalkwyk, we were forecasting what might be future cervical cancer incidence rates in South Africa under various different policies. You can see here the black line is the forecast over the next 100 years if we make no changes to current policy. And you can see that we're forecasting quite a substantial reduction in cervical cancer incidence, largely as a result of the HPV vaccination program in South Africa. The blue and red lines here are showing you what we might expect with various improvements to that vaccination program. And the yellow and green lines are showing you what we might expect if we were to move away from the current pap smear screening program for cervical cancer and to adopt more modern DNA-based detection methods. I also mentioned the Naomi model that is used to produce district-level HIV estimates in South Africa, and this map here is one example of the outputs of the Naomi model. You can see here the relative levels of HIV prevalence, relatively low in the western half of the country, and then highest in the districts bordering Eswatini. I also talked about the HIV investment case, which is a project to identify what are the most cost-effective strategies in South Africa and the strategies that we should prioritize in our HIV programs. So this is showing the results from the most recent HIV investment case led by Lisa Jamison. This table is showing various different changes that could be made potentially to our current HIV program. Not necessarily new interventions, but in most cases, increasing coverage of existing interventions. And so for each row, we are quantifying the number of life years that would be saved over the period up to 2040, the incremental cost, how much additional budget we would need in order to introduce those programs, and the cost per life year saved, which is what health economists refer to as the incremental cost effectiveness ratio. We've ranked these different interventions according to that cost effectiveness ratio. And you can see the most cost effective, in fact, the only intervention that would be cost saving is condom distribution. Following that are three other increases to current programs that we could afford within our current HIV budget envelope. And everything below that is unfortunately interventions that we would not be able to afford given our current HIV budget. So we refer to this as the unconstrained scenario. These are the things we could add if we had unlimited healthcare budget. And sorry, I meant to say that this is this HIV investment case work is quite extensively used by the Department of Health in identifying which programs to prioritize and also in budgeting for how much we need for these different programs. So to summarize, Tembisa is a dynamic model that we've developed especially for South Africa. It's a leading source of HIV, TB, and demographic estimates. We've developed national and provincial versions of the model, and although it's not a district level model, the Naomi model works closely with the Tembisa model to produce those district level estimates. And there are a number of other dynamic mathematical models that have been developed for South Africa. So thank you for the invitation to present, and I'm happy to answer questions. Thanks.
Thanks, Dr. Lee. Yeah, so there are a couple of questions. I'm going to start with Roseanne's question. Tom, Roseanne says that she still has a copy of the presentation that you did, your paper. And thanks for the incredible and often brave contribution you've made to informing many important policy debates with facts and robust analysis over the years. What do you think we can do as a profession to build trust in this? How do we and can we demonstrate that we are seeking to contribute and apply our skills and knowledge in the public interest despite where we are employed?
Yeah, thanks, Lasani, and thanks, Roseanne. These are the crucial questions, I think, really, actuaries who are wanting to engage with public interest work really need to grapple with. And part of my point was, of mentioning that, there is a strong overlap between where actuaries are employed and the industry which employs them. And of course, that manifests itself in multiple ways. The CEOs of most of the big life insurance companies are actuaries. It stands to reason. It's a very good reason why they're actuaries as CEOs of those companies, or the big reinsurance companies or the big medical aid schemes or other entities. The challenge really is for the profession as a profession to establish that it can have its own view, which might be somewhat different, not necessarily completely orthogonal to that of their employers. We've seen, for example, certain medical aid schemes with NHI have been running around a little bit like Chicken Little, screaming that the sky is going to fall on their heads. That might well be the case for those companies. I'm not an expert in that, but where the profession needs to go is in a somewhat different direction, is to say, well, that's for the companies to argue that the sky might fall on their heads and this might be really deleterious to their well-being. But as a public interest actuary, one would have to take a somewhat calmer and possibly more measured view of looking at the ramifications of this far beyond that of a narrow corporate sectoral interest, but to say, what would this mean for the National Treasury? What would this mean for the Department of Health? What would it mean for infrastructure? What would it mean for costing the kind of infrastructure required to roll out NHI as currently envisaged at a district level? What are the impacts on the fiscus there? Now, those are things that actuaries are uniquely well qualified to do. Okay, to estimate demand for doctors and loads and the financial risk and discounting and what's the infrastructure investment required. Now, one can do that without saying, and therefore this is unaffordable. The role of the profession to say, this is what it's going to cost. If that is the political decision to go ahead and do it, well, then one presumes that the fiscus must find the revenue from somewhere. But if the profession says NHI, for example, is a really bad idea, that is effectively going to see its cost as the as the flag wavers and standard bearers for the industry. And what I'm trying to argue is that there needs to be a kind of, even though most of the people in this room, including Roseanne herself, is a very senior person in industry, are actuaries and are very senior people in industries, there has to be a creation of clear blue water between the views of the profession and the views of the industry, and where public interest actuaries are able to speak as saying, we are a group of public interest actuaries, or we are the actuarial society, or speak on behalf of the actuarial society, to say we appreciate the views of industry, but we are not beholden to them. And I think that is the crucial part, which is a very difficult role to play. It often might involve, accepting that people who are very senior in industry should really not be speaking on behalf of the actuarial society unless there is a complete overlap of those views. So to gradually see the idea that where actuaries can bring is not simply an exercise in protecting their own interests or their employers' interests, but they are seeking to act in the interest of the society as a whole, and that would be good for the profession. Thanks, Lasani.
Sure. You used better English than I can ever do, but it certainly has been what we have been trying to do. it is the reason why the position was created of the public interest actuary. It's actually to look at things more broadly than narrowly, as you have described. It's not easy waters. That it has its challenges. But I think that we can expect ourselves as a profession to mature in that regard. And I think this is part of the process. So thanks for raising that issue in the context of the topic of demography. And thanks, Roseanne, for asking the question as well. So that's a very important issue that you put on the table. There's a question here for Lee. Can the Tembisa model be adjusted to inform select scenarios such as insured lives? So I'm not sure if I've so I think that was about it. I don't think Lee?
Yeah, thanks for that question. So the short answer is no. We are trying to estimate mortality levels at a population level. A long time ago, the Actuarial Society, and this was back in the days when we had an AIDS committee, developed a special model for select, it was called the ASSA Select model, which was developed especially to take the population level estimates and kind of convert them into the mortality rates that we might expect in a kind of a subpopulation like a medical scheme or a workforce or a portfolio of insured lives. I must admit I haven't really kept up to speed with what has happened on that select model. I know that there was further work done, but it's been a while since I was involved in that.
So I want to get from both of you what needs to happen. Number one, do we need more people like yourselves? Do we need more this sort of Lee, you're a crossbreed. Do we need more crossbreeds? Tom, you're also you did actuarial science, you did your degree in that, you worked in the space, and so you're also a crossbreed. How do we crossbreed? What must we do so that we have people like that who think the way you're thinking and more?
Yeah, I think there's a phrase which the youth use. My two university level students endlessly tell me to stay in my lane, and there's an element of that which I think is appropriate. But at the same time, I think a strict injunction to stay in your lane is also unhelpful. And I think that what can actuaries do? I've talked about their ability to understand, quantify, interpret, measure risk of various forms, and often with a financial element to that. That is something which actuaries are uniquely qualified to do. They are not necessarily best qualified to develop from first principles the kind of epidemiological models which Lee has and others have developed of various kinds, or necessarily to kind of upskill themselves in the arcana of methods of demographic estimation, even of mortality from limited, defective, and deficient data. Those things are in some ways specialist. Where I think that, the use lies is actually building the conversations, not for actually said, no, they can't solve all these problems directly themselves. How would they make use of data from Tembisa? Someone was asking whether they could produce data for assured lives. The answer is no, it can't. But what could one do? And to start conversations with people in cognate disciplines, whether it's epidemiological modeling, healthcare, or higher education funding experts, demographers, and to really say, well, you have, as a profession, you have particular interests and particular skills and particular questions, which you could contribute massively to for the benefit of society. But at some point, you might need to realize where you don't know. And what you don't know, and therefore who to speak to. One of the interlocutors in the chat, I think it was Megan Carswell, said, kind of, there is some demography still in the FA 108 paper. Although I've just checked the syllabus, and a lot of it is descriptive. But she says then, well, kind of, would we as demographers be willing to assist or work with actuaries? And the answer is yes. That where you are struggling, where you say, how do I make sense of these data? I think actuaries are so used to the data being so good, so perfect, so directly usable that the appreciation that the kind of data which demographers deal with are messy and ugly. Is where the rubber is going to hit the road for actuaries trying to engage with public sector interests. So I think these are conversations. I think there needs to be an outreach rather than a kind of closing off and a walling off of one's discipline.
Yeah.
Thanks.
And actually like me would not even be interested to do anything with Lee's models. So please, rest assured, I wouldn't even be interested. But yes, I mean, there is a place where value can be added, and it's just an idea of how to go about that. And I mean, if you look, I mean, touching to the point that you raised, you've got here's an actuary. They've worked in a life insurance company like you did, Tom, but they're interested to work more in this sort of public interest spaces and so on. What must they do?
Well, I mean, I think that there are so many pressing questions that actuaries could apply their minds to, of a public interest nature, and not just the big hairy beasts which are currently occupying everyone's heads: higher education funding, NHI, etc. There are a multiplicity of social problems, social forces, social engagements, which I think could really benefit from actually starting off by saying, let's move from looking more only at private sector provision, but trying to cost out what the implications are for the pay-as-you-go funded state system. I know at one point there was an idea for the office, or an actuary's office, a government actuary's office in South Africa. That's never happened. Where are actuaries as a group of actuaries engaging with that? And that would involve understand your knowledge, would involve a detailed understanding of demography and how the population is likely to age, and economists to give you an idea of what the implications are for the fiscus. But that is something which the actuaries should really be working on far more than anyone else. You've got the prime skills. All the other role players have only parts of those skills to add to your abilities and to your skills.
Yeah. So here's a question from Jeremy Andrew. I don't know if you know Jeremy Andrew. He serves with us on the Public Interest Governance Committee, and he's been in the profession for a very long time, maybe longer than I've been alive. How difficult would it be to model both population and income levels, as the financing of Social Security and NHI will require this?
So we've done that to some extent in a separate model, not the same Tembisa model that I've been describing, but we've developed a separate agent-based model called Microcosm, which simulates networks of individuals in South Africa. It relies on the sort of Tembisa model for inputs on sort of total population size and age stratification, but it is intended to answer a lot of those detailed questions around relationship between socioeconomic status and health. The work is still, I would say, in its incipient stages. We haven't yet published it, but we will be presenting it, some of the work, next month. So yeah, the work is happening in that space.
All right. So Tom, you say your answer has died. I mean, your sound. Sorry, your sound has died. It's okay. Yeah. So this was the last question. So maybe just all right. Yeah. I won't even try to interpret what Lee. If you can interpret what Tom is saying, you're welcome to. But I wanted to give both of you an opportunity for closing remarks. I know, Tom, you're having a challenge, so Lee, it will be up to you then.
Yeah, I mean, I think I don't have much to add, but just in response to some of the previous discussions, I think it would also help a lot if there was more funding for research, both in terms of expanding capacity within the profession to do this kind of work, and in terms of bringing in people from other professions. I will mention that in the early stages of developing Timbisa, we were in discussions with the Actuarial Society around potentially funding that work. But it was felt that the resources required in order to fund the Timbisa model were just too much really to be able to provide the funding we needed. So unfortunately, we've had to rely very much, or maybe not unfortunately, but we've had to rely very much on international donors to support the research work that we do. And it would be nice to see more domestic funding for this kind of work. I think it would really also be a great branding opportunity for the Actuarial Society in terms of getting recognition for what is a public good. Thanks.
No, thanks. Prof, Tom, you're back on?
Yes, sorry about that. My sound died completely, so I heard the start of Jeremy's question and tried to answer it, at least in the chat. Yeah, I mean, I think that, kind of just because something is difficult doesn't mean to say one shouldn't try it. And I think that, where, even though things can be horrendously complicated, that is where actuaries are best qualified to understand that complexity and to contribute to those debates, even if it's to explain, why and how sensitive models are of the kind that Jeremy was talking about would be, and what the implications of those things might look like. So thank you.
So thank you both for your time. I know we've spent time preparing, chatting, and you've done very well, and it's very informative. And I'm sure that there are gonna be some actuaries who are listening who would want to do more of what you are doing and learn more and so on. So, and as the Actuarial Society, I think there will be a lot that we do with you going forward. I can just imagine that. So thank you very much for your time. And everyone else, we're gonna take a break now, and then you don't want to miss what's coming at 12 o'clock. So I hope that the minister hasn't sent Anban somewhere else. So far, so good. But let's meet at 12 so we can join back in maybe 10 minutes before. So, that gives us only 10 minutes, but 5 minutes before, so that we can start immediately at 12 o'clock. Thank you very much. See you later. For coming back, and you can tell your colleagues as well, it's all happening, so they can also jump in. We have the privilege here of having Dr. Anban Pillay, who is the Deputy Director General in the National Department of Health, and we've asked him to come and just share everything he knows about the National Health Insurance, and then we will have a discussion. So we're going to be together for 90 minutes. So he will present for at least 30 minutes. It might be longer. It might even go to an hour. We want to know everything that there is to know. And then we will still have at least half an hour to actually deliberate on this. So over to you, Dr. Anban. I don't want to waste any time. Thank you.
Thank you. Thank you very much. Thank you for the invitation to speak to you today. So yes, I have a presentation, some slides relating to the National Health Insurance Act. I don't think I'll take as long as an hour, but let's see how it goes. So I think probably there'll be more time for questions. So I think it's important to just say a little bit about the bill itself and what its intention is. Or its purpose as such. So the bill establishes a National Health Insurance Fund, which is now an act as such, and it's a legally defined organ of state as a Section 3A entity, and I'll say more about that just now. The bill also seeks to establish the functions, powers, and duties of this fund. So what will this fund do, in other words? It also provides for the control of the fund by the board, and what's the relationship between the fund and the board which governs it, in terms of, who are the members, how will the chair and vice chair be selected, how will they have meetings, who's eligible to be a board member, etc. And then the bill also seeks to define the beneficiaries of the service. So who is eligible to get access to the services that will be financed through the fund. And then clearly looking at the providers then on the other side, how will they be contracted for these services, and what will be the basis for considering them for both accreditation and reimbursement, and what would that look like, and also then to determine the health benefits that the fund will identify. So let me say, in legislation in general, we do not provide a huge amount of detail relating to, for example, benefits and details of contracting, etc., or reimbursement, simply because these are dynamic issues that will change from time to time. And in order to be responsive, once you put that in an act, the problem is that you then have to go back each time to Parliament in terms of our legislation in order to do that. So once we have an act that's approved, like this one, we will then have regulations which provide a lot more detail relating to each of these aspects. But the principal act, or the NHI Act in this case, must create the framework by which the detail will follow. So, and the detail, as I said, will change from time to time. So let me go to the next slide. So the layout of the chapters in the Act, for those that have not gone through it from kind of cover to cover, it basically has a purpose and application. It then goes through how services will be accessed, talks about the fund itself, and then the board. Part 5 goes into how the CEO will be appointed. Part 6 talks about the committees, and then 7, the advisory committees. Some general provisions in Part 8. There's provision for complaints and appeals. Part 10 deals with financial matters, and there's some miscellaneous issues in Part 11. But we'll go through each one of these now in a little bit more detail. So I've just kind of picked out what I would consider to be, the kind of key issues in each part of the legislation. Firstly, so the purpose is clearly to establish the fund, as I indicated, through a mandatory prepayment system. And I think that's key. So the fund will be financed through a prepayment system, as opposed to a system where patients would pay at the point of care, in order to achieve a sustainable and affordable universal access to quality health services. Then the other key issue is that the fund is a single purchaser and a single payer of health services. And this is done by pooling the funds and strategically purchasing health services, which is a significant deviation from the way government does business currently, in terms of purchasing of health services from those accredited and contracted healthcare providers that will be participating in the fund. In terms of the application, this applies to all health establishments, except the 2 exceptions are the military health services, simply because their structure is completely different from the way health services are generally run. The military runs their own health service, and the State Security Agency, which is a fairly small group, largely due to reasons of confidentiality and secrecy, etc., that the State Security Agency has. The Act does not affect the funding and functions of any organs of state relating to health services until the relevant legislation has been enacted. So in other words, once the Act has been brought into force, like it has now, each section would need to be proclaimed in order for those sections to become effective. So organs of state will continue to operate as they have been until such point as there's proclamation of particular sections. And this is not I mean, unusual. In the National Health Act, we have several sections that have not necessarily been proclaimed. So this is done when the state is ready with the resources and other things to be able to implement this. Then this is a standard clause that generally is in many pieces of legislation where lawyers try and identify conflicts with other legislation. They usually deal with it in the legislation, but they argue that if there are conflicts between this legislation and the other, this legislation, the interpretation of this legislation will then prevail. The only exceptions being the Constitution and the Public Finance Management Act. So Chapter 2 deals with access to healthcare services. And here the question is, well, who will get access to services? And clearly South African citizens will have access, so will permanent residents, refugees, inmates, and any specific category and specific category, sorry, of foreign nationals that will be eligible. Asylum seekers and illegal foreigners will have access to emergency medical services, notifiable medical conditions, as a list of those, as well as basic healthcare services at a primary care level largely. Care for all children will occur irrespective of any other provision. And visiting foreign nationals who would like to access care would need to have some form of travel insurance, which would then reimburse the fund for services that foreign nationals may access through the National Health Insurance Service. In terms of registrations, every eligible person, as the eligible groups described above, must register with the accredited healthcare provider that's at a primary care level or establishment, so that the fund would know exactly where patients will be accessing care or where they will be usually accessing care. We do appreciate, I think, that South Africans are quite mobile, and so people will move around to some or other extent. Newborns will automatically be registered when that happens, and then supervising adults must register children in the child-headed households. Biometric and other prescribed information may be recorded at the first visit of an accredited provider, so that all of that information is stored within the database of the fund to access services. So just continuing on the access to healthcare services, the users of services clearly will have a number of rights. The first and most important is that the quality of health services must be an acceptable standard as defined by the Office of Health Standards Compliance and monitors that. And secondly, these services would be free at the point of care. Any person must have information relating to the fund, what are the services that he or she are entitled to, and any other information that one may require. You can't be refused care on unreasonable grounds, and if you are refused care, you need to be provided with some reason about why care will not be provided. Access to care must be within a reasonable time frame, and I think from time to time this will probably be defined in regulations and or guidelines, so that waiting times, we know, is a big issue for many people. There needs to be reasonable decisions about person's healthcare, so the patient must be able to participate in the decision about what interventions are available and would be preferred. Clearly, a user must be able to submit a complaint where the service was found to be unacceptable in some other way. And there should be written reasons for fund decisions, particularly where there is denial of care, etc. Where clearly the services are not covered by the fund, complementary voluntary health insurance cover will certainly be available for such a person to be able to purchase. Moving to the area of service coverage. So the fund must purchase these services on behalf of all beneficiaries. And whether a provider or establishment is unable to provide a registered service, then the facility or provider must transfer the user to another provider or establishment. So sometimes a facility may not be able to deliver a particular service for whatever reason. And so that facility must then take responsibility for that transfer. Along a similar line, the issue of referrals, or what we call referral pathways, where users would enter the system through the primary care level and then be referred to higher levels of care, specialists and specialized hospitals, etc., as part of the referral system, which will be defined in the case of each condition and linked to obviously the severity. In the case of central hospitals, which are public hospitals that currently are deemed as central across the country, they will enjoy a semi-autonomous status, which means that they will be national government components and being able to operate independently of the provincial government and the national government. So they're able to make decisions about their finances, hiring of staff, maintenance, and all of those things. Many of the problems in many of our large hospitals are plagued largely by delegations to be able to deal with issues. Treatment will not be funded clearly if there's no medical necessity, meaning that where something is medically unnecessary and there's another need for it, then that will not be funded. Here, cosmetic surgery comes to mind as an example. Alternatively, where it's not cost effective, so there's an alternative cost effective option, or the treatment along the lines of cost effectiveness is not on the formulary, so drugs that are not on the formulary clearly will not be funded. So if the fund declines a benefit, they have to provide reasons, as I mentioned earlier. And then on the issue of cost coverage, it's free at the point of care. Moving now to the fund itself. So the fund is a Section 3A public entity. There are several Section 3A public entities in health currently. The Medical Research Council being one example, the NHLS, SAPRA, etc., all 3A entities. They report into the minister, and their requirements legislatively, governance, etc., are well defined in terms of the PFMA, and the National Treasury also has a significant oversight over these entities. So what will the fund do? Well, it must actively purchase services and enter into procurement contracts for goods. The fund must pay providers in a timely manner. The rates must be determined annually, so the fund will need to negotiate with providers and determine exactly what the rates the fund will be paying, and pay those on an annual basis. There must also be appropriate funding for healthcare services at various levels. So the fund must provide services from primary care all the way to tertiary level services or quaternary level services. The fund is also required to monitor the quality and standard of healthcare services that are available. So it's not simply a case of just paying for services. The fund needs to take seriously the quality that the services that are being delivered and monitor that. The fund is also required to get into pay for performance agreements with providers. So rather than simply paying for services, also paying for outcomes. In order to do that, the fund clearly would need to collect data around outcomes to be able to use that as a basis for reimbursement. Fund must also monitor the impact it has on addressing healthcare needs. So is it making a dent on a particular disease burden? There may be exchange of information between the fund and other entities, as well as the National Department, the statutory professional councils like the Health Professions Council, etc. There would also be a database of the population, both in terms of the demographic and epidemiological profiles. Very important to understand the burden of disease, but also to allocate resources appropriately given the distribution and size of that disease burden. Also to perform functions that may be cost effective and efficient. So the fund is required to make decisions at all times that would be cost effective and efficient. And these funding must be aligned to policies that have been approved by the minister. They also have a responsibility to contribute to the protection, promotion, improvement, and maintenance of the health of the population. In terms of powers of the fund clearly must be able to employ its own personnel, purchase goods and services and land, etc. Being able to draft and accept promissory notes, which is standard language in most of the entities. It must also clearly insure itself against liability. And where there are complaints, the fund must investigate those complaints and be accountable for them. It must implement best practices in terms of purchasing, procurement, and efficient delivery of services. Also, research relating to improving UHC and how universal health coverage can be improved in terms of access to affordable services of good quality, exchanging information with other organs of state, and where there are legal proceedings, clearly it must defend itself. And at all times, I think this was highlighted previously as well, it must negotiate the lowest possible price for goods and services. Coming now to the board, which is the governance board of the fund. The board is the body that basically oversees the operation of the fund and is accountable to the minister. So how is the board constituted? Well, there are 11 members that will be appointed by the minister after approval from cabinet. There is a list of experts that have been identified, healthcare, financing, economics, etc. That's usually kind of a standard set of skills given the type of requirements of the organization. The board members will have a 5-year term, which can be renewed once. So in other words, a member cannot serve more than 10 years. Clearly, where individuals have conflicts of interest, etc., those will need to be excluded, and there'll clearly have to be a process to vet individuals to make sure that they are compliant. The minister is required in terms of the Act to appoint an ad hoc panel that once he receives, he will call for nominations and CVs would be submitted. Thereafter, there would be an ad hoc panel appointed by the minister that would interview these candidates, and these candidates that are interviewed will then result in a shortlist from the ad hoc panel to the minister of people that potentially would be appropriate for each of the different positions on the board. Clearly, where a member of a board is acting inappropriately, has a conflict, or some other information comes to light, the minister may remove that person. If the entire board becomes dysfunctional, the minister also has powers to dissolve the board and appoint another board. The chairperson is appointed by the minister, but after consulting with cabinet, and a board will select the deputy from amongst its members. The board clearly must function as an accounting authority, and that's defined in the PFMA as to what the board is expected to do. They should meet at least 4 times a year and advise the minister on how the fund is operating, particularly its finances, administration, pricing, etc. And the types of reports that will be required from the executive management, the board will need to define so that it has a good handle of what's happening within the organization. So clearly any paid employment that will be a conflict with the work of the fund must be identified, but there'll need to be vetting as well to identify such conflicts and see how they best deal with. So procedures about how the board would deal with matters, etc., are left largely to the members of the board to determine. The rates that each member of the board is paid is a process that requires the Treasury who rate boards and then identify what would be an appropriate reimbursement level. We come then to the CEO, Chief Executive Officer for the fund. This person must be a technically competent and experienced individual. And then here the board must interview the candidates and recommend to the minister a short list at least of suitable candidates by which the minister can then select the most appropriate one. The term is again 5 years, renewable once, so a chief executive as well, similar to a board member, would have just one renewable term. And the board may recommend the removal of the CEO if he or she is not seen to be performing their functions, or some other information comes to light that requires the board to make such a recommendation. So the CEO must account to the board clearly, and the functions that are designated to the board, the CEO will perform, and clearly must run an efficient organization dealing with all of the issues that the fund is responsible for, including dealing with issues of fraud and corruption, which are a risk clearly to the fund. There's a district health management office, and the chief executive officer would need to engage with that. There are a variety of units that must be established within the fund, including the planning unit, benefits, the provider rates and payments, accreditation, purchasing, contracting, payment administration, performance monitoring, risk and fraud. So all of these are units within the fund, and they perform functions linked to the overall responsibility of the fund within that specific area, as outlined. The fund must produce an annual report like any 3A entity, and the CEO must make sure that happens. There's also a requirement that the CEO meets regularly with the minister as well as the DG, the Office of Standards Compliance at least, so that there can be engagements on issues of mutual interest. In terms of the committees, the board can determine its own governance committees, but I mean, most boards have a number of committees that assist the board to do its work. In addition, the board may also establish technical committees, and it needs to have appropriately skilled people to be able to participate in these committees. So there are governance committees, but also provision made for technical committees. There are also then advisory committees to be established by the minister, and these advisory committees, there are 3 here that are outlined. The first is the Benefit Advisory Committee, and this committee must be able to give the minister advice on what would be an appropriate set of benefits, and this must be obviously matched with what the budget is available to be able to offer a particular set of benefits. There will be clearly terms of reference by which they would need to operate, and their advice then becomes the basis on which the minister can make some decisions about what benefits will be offered, together with the fund clearly. The second is the Pricing Committee, and this committee is intended to recommend prices for the benefits that the Benefits Committee is talking about. So they need to work very closely. Again, here, the set of appropriate skills are required, actuarial science being one. And these members, again, must investigate, engage, and being able to come up with a set of prices that would be appropriate for the benefits, which in some ways will then determine which benefits can be offered, given that the fund would always be operating within a defined budget that's been outlined from the Treasury. There are also a number of stakeholder advisory committees. So a fund of this nature will attract a lot of interest from various stakeholders, civil society, patient groups, etc., advocacy groups. And so there is an opportunity for a stakeholder advisory committee, which will share with the minister their views about how the fund is operating, the challenges that they see, and how they see this being amended. So other provisions, well, dealing with the role of the minister, well, the minister is responsible for the national health system, and the fund is part of that. So that's where the minister's overall responsibility lies. Well, one of the things the minister must do is delineate the role of the fund and separate that from the role of the national department, the role of the provincial departments, taking account of what is in the Constitution, the National Health Act, so we don't have duplication as well as financing issues between the different sectors or units that are responsible for this. The the Department of Health, as such, is responsible for norms and standards. And this the DG would be responsible for the human resources planning, coordination of health services, the planning and development of both public and private health establishments, integration of annual reports for the health system. And there may also be other amendments to the National Health Act or any other legislation that the National Department will be responsible. So many of these functions are currently the responsibility of the National Department, but this was just noted so that there's no misunderstanding. Similarly, in the case of provinces, just to make the point that the minister will delegate to provinces the functions as management agents. And so you may wonder, why is it done this way? Well, the reason is that if the minister is held accountable, he needs to be able to hold the parties that he's delegated to accountable. But in the current arrangement, the way the National Health Act is structured, it's a bit difficult for the minister to hold individuals working at a provincial level accountable, given the current structure of the system. So this system will allow for delegation, but would allow the minister to be able to intervene much more easily in the delivery of services. So in addition to the services that the province currently would be responsible for and which would be delegated back to them, one would anticipate in most cases, there would also be emergency medical services that the province is responsible for. They would also be assisting the District Health Management Office in dealing with issues of quality of health services and facilities and managing the district health service delivery platform. The delegation of provincial and regional hospitals, as well as specialized hospitals, will be a function of the provincial departments. And where there are interprovincial issues, again, the provinces will be responsible, as well as technical and logistical support for district health councils. And where there are disasters and the like, these would be also within the responsibility of provincial health departments. So I think this is a little bit of a repeat, but within the emergency medical services also, there's forensic pathology, medical legal services, the mortuaries, as well as all the equipment and infrastructure that is currently in provinces remain the property of the province. So the fund doesn't take ownership of any of those assets. Clearly the province would be consulting with the community on health matters, promote health and healthy lifestyles. So a lot of the public health programs, including environmental health control, and then ensuring that there's health systems research and public programs that are linked to public health benefits, that for example, a vaccination service, etc., would be largely a provincial function, and funds would then follow that function. So just some general provisions, and I think this provision probably is the one that's attracted the most discussion and debate, which says that once the NHI is fully implemented, the minister will introduce regulations limiting benefits to services not reimbursable by the fund. So in essence, this means that from time to time, the fund will be reimbursing a particular package of services, and that package will be determined largely by what budget is available to the fund. And whatever is then not covered will then be covered by medical schemes, where medical schemes choose to offer that as a benefit, clearly. There's the District Health Management Office. The District Health Management Office is a national government component, and government components by their nature have a degree of independence. And the intention here is to allow them to be able to coordinate services at a district level quite independently of the provincial or national department, so that they can be greater powers at a local level to be able to deal with that. There is also the term CUPS, or what's referred to as Contracting Unit for Primary Health Care, and this would be the preferred organizational unit to manage fund contracts at a primary care level. So this contracting unit would clearly be responsible for the contracting of services at a district hospital, but most clinics, CHCs, as well as private providers, your GPs, your dentists, your physiotherapists, optometrists, and the like. And it would also then deal with in the contracting, deal with how accreditation would happen, contract management, and make sure that the referral pathways are well understood and implemented in terms of the way the fund sees that happening. There's also provision for what's referred to as a health products procurement unit. And this is largely a centralized procurement function where goods will be procured or contracted centrally, but obviously procured at a local level. But the benefit being of having a single purchasing agreement for a larger volume of particular medicines would achieve a number of efficiencies if they're done nationally, as we do now, actually, in many cases. So this office will deal with the medicines as well as medical products, and there will be a formulary that needs to align to whatever is the benefit package. Where there's new medicines, there needs to be an assessment of whether they can be provided, looking at their price as well as their benefit, and this is part of the process of benefits as well. In terms of the accreditation of service providers, well, here, firstly, let me say that the Office of Health Standards Compliance will be responsible for certification. So whether a service provider is intending to contract to the NHI or not, that provider would need certification from the OHSC, because that's just a mandatory quality issue. Thereafter, there needs to be a minimum range of services that the fund is looking for, and would then, on that basis, accredit a particular provider to be able to provide those services. If the provider is accredited, the provider would need to understand that they would need to have a particular mix of health professionals linked to the type of services that they're offering. They would need to adhere to the protocols as the fund has described, and then the referral pathways when referrals happen and how they managed, as well as providing information to the fund about where there's diagnostics that were done, procedures, where the patient was hospitalized, the length of stay, etc., so that the fund has a full database of information on services utilized. The provider clearly would have to agree to the national pricing regimen at that point in time in order to have a valid contract. And these contracts will be in the form of some binding agreement and could last up to a maximum of 5 years. Clearly, the conditions of renewal will be linked to whether the package of services that the facility is offering remains the same, and the certification from the OHSC is also there, staffing mix, etc. If a provider has been refused accreditation for whatever reason, there is an appeals process as well, by which he or she may then raise concerns about why it is that they were not contracted. So the information platform for the fund, clearly, I mean, the fund is going to require lots and lots of information at various levels, and this information needs to be utilized for the purposes of making sure the fund plans better budgets and making sure that the outcomes are linked to the intention of the fund. So an information platform is in development currently that would have would create what's referred to as an electronic health record, so that there's visibility of services accessed, etc. And would also obviously assist in with this portability of services. If I go down to Cape Town and I get ill, one could the provider there could clearly see details of my care and laboratory results, etc. Payment of providers. Well, primary care providers will be contracted and remunerated via the CUPs, as I mentioned. Specialists and hospitals, we're looking at some performance-based reimbursement there. EMS capped case-based fee, and the regulations relating to all of these payment mechanisms will need to be developed by the minister and obviously revised from time to time as the market evolves and the dynamics of the market are understood to be able to respond appropriately. The fund also has or the Act, sorry, creates provision for a complaints and appeals process. So there must be the fund must set up a complaints mechanism to investigate where complaints about the fund occur, or service delivery rather, and deal with those. Where one is not satisfied with those responses, one can lodge an appeal. There's an appeals tribunal that can be set up, appointed by the minister, and this tribunal have a similar powers to the High Court, where it may decide to set aside a decision of the fund. For example, if the fund decided not to reimburse a particular condition or treatment, etc., the tribunal could do so. The complaints process is run very much like many of the others, where there's a secretariat and there would be a committee that deals with these issues. So on financial matters, which is another area of much interest. So the sources of funding are predominantly appropriation. So in other words, transfers from the National Treasury through to the fund. Interest and bequests will make a very small proportion of that, one would anticipate. And the Treasury will determine clearly what the extent of the appropriations are. And the appropriations will clearly need to be financed through general taxation, shifting portions from the provincial equitable share, the conditional grants, the medical scheme tax credits, payroll tax, etc. But this is a suite of options available to the Treasury, and I guess from time to time they may mix and match the extent to which these would make a contribution. But there is no dedicated NHI tax as such. It would go into the general revenue, and from there would be an appropriation to the fund on an annual basis. The fund will clearly have to be audited, and here the Auditor General would have that responsibility. And then there are annual reports, quarterly reports, etc. These are all defined very well in the PFMA for a Section 3A entity, and so the fund must comply with all of those as defined for 3A entities. So under miscellaneous, there's assignment of duties and delegation of powers where those may be required. There's also a section on protection of confidential information, linked largely to general legislation around this, provision for offenses and penalties, as well as regulations and directives. Then there's a section relating to transitional arrangements, and there's an estimate of when these would happen. I emphasize estimate because these would need to take as long as they do to be able to be ready. So the phase 1 transition goes to 2026, relating to health system strengthening, legislation, having a fully functional fund, a board appointed, and purchasing some services, particularly for vulnerable groups. So the Act also identifies that the first place to start is vulnerable groups, and purchasing services for them as a start for the fund as it expands and its budget increases, etc. and then putting together the committee such as the Tertiary Services and Training Committee, the Benefits, Health Technology Assessment, etc. So all of that's part of phase one, and then phase two continues with that. Additional resources, as I said, the fund will progressively increase the extent to which it will be providing and funding particular services. And then there'll be selective contracting within the private sector in terms of the private providers. And that will change from time to time as services are procured and private providers are available to deliver such services. Important to also bear in mind that there's a number of legislative amendments that the NHI brings with it, and these legislative amendments are also within the Act, and they will be amended as part of the what is referred to as consequential amendments. And so we anticipate that that will happen as clauses are brought into effect. And so I'll stop at this point, Lusani. I think I said a mouthful there, but hopefully I've dealt with some of the issues that may be questions.
Yes, so we already do have quite a number of questions. I'm gonna read a few, and then you can then tackle them, and then I'll read more. So
Okay.
there's a question, is that South Africans travel a lot within South Africa. How will that be addressed, given that outpatient services will be on a capitation basis? Is there room for interoperability? So that's the question number one. Number two, the units to be established are super. Where would the data analytics department fall? That's question number two. And then, how does it's a couple of questions, three questions asked by the same person. How does the budget for the NHI compare with the current healthcare budget for SA? And then question number two, what is this expected to be as a proportion of the total government budget? And then how does this compare to other countries with an NHI system, both as a percentage of total given spend and on per capita basis? And then NHI has failed in many countries, including first world countries. Why will it work in South Africa, given the level of corruption? See recent COVID and tender issues. And then there's a contribution here by Roseanne Harris. It says, thank you so much for joining our session today and sharing this information. Many of us who have been working in healthcare financing in South Africa for many years have some serious concerns around the feasibility of the single fund approach. The risks have been well established in global experience, especially in countries of similar economic levels, and sadly are exacerbated by our unemployment levels and narrow and shrinking tax base, not to mention other social spending pressures. We really wish that it was feasible to raise the funds and have the resources to provide comprehensive benefits to everyone. How can the actuarial profession contribute constructively to building a framework that will work for the benefit of all in South Africa, given the political commitment to this model? And I suppose that is the single fund model. We have made submissions during the legislative processes, but these do not seem to have been given consideration. We really want to support and help to improve healthcare access for everyone. That is Roseanne Harris. There is a follow-up. I think I maybe should read it as well a bit, because it will just help you to have a comprehensive response. Some more specific questions relating to actuarial risk. How will the fiscal responsibility of the Benefits Advisory Committee be managed, as the services they define essentially create a liability that has to be funded by taxes as the sole source of revenue, and there is a risk that higher utilization levels lead to a deficit, as international experience has demonstrated, that will therefore that will require tax-funded bailouts? It's a question. And then number 2, is there a definition for what fully implemented means? And then number 3, what is the governance or accountability structure for the CAPs? I can't remember how that was defined, but you probably know this CAPs, to ensure contracting is sustainable, since it seems that CAP is made up of the parties the fund will contract with. And then number 4, is it feasible to increase taxes on the employed population to the extent suggested and direct all of this to health given the other social demands, particularly considering where we are on the LAFA or LAFA, I think it's the LAFA curve already. I think that is a mouthful for now. Yeah.
Okay, shall I deal with these then, Lusani?
Please do.
Okay. So I think on the issue of travel, yes, I think capitation systems have over time developed mechanisms to allow for where a person moves around, or, you know, and the example I gave, I traveled to Cape Town for a meeting, fall ill, etc. I have a selected provider here where I live in Pretoria, but clearly the system would need to have a mechanism by which there can be reimbursement when I'm outside of my usual residence, etc. So I think there'll be a mechanism for that. Within the NHI fund, there is a provision for data analytics. It's a critical part of the fund, clearly, because if the fund doesn't know where things are going and being able to appreciate the challenges that it may be facing, which would only come through in data. So data analytics is a very important part. In terms of the budget, well, what would be the budget of the NHI? Well, we don't know what the budget's going to be, because that's what Treasury needs to allocate. And so comparing it with what our current budget is would be difficult to kind of say what that is until it's allocated. But what I can say is that there's an appreciation that our current expenditure on health, public and private together, should be able to provide us with a reasonable package of services that would service the entire population. Well, the extent to which, for example, the US spends on healthcare relative to the GDP or government expenditure, or overall expenditure rather, is obviously an excessive level, and so I don't think the Treasury would go anywhere close to that. So I think over time we will see the system maturing and understand what prices look like, what utilization look like, and then to what extent will the benefit package be expanded, because I think these are all obviously the moving parts that need to come together. Well, I mean, saying NHI has failed, I'm not sure how to respond to that, because I'm not aware of any governments that have abandoned the health insurance initiative. I think it's important to appreciate that in every country that has implemented either a national health insurance system, a single payer model, or a multi-payer model, they have challenges because no model is perfect. And clearly we would need to be alive to the challenges that a particular model brings with it, and respond to the issues that arise out of that. And I think the citizens who access care will from time to time want better and better services. So the challenges about whether it's a single funder or multi-funder in each country and how people see it is largely their expectation of what they're expecting relative to what they received last year or the year before. To Roseanne's question on how can the actuarial profession assist, I think, we've gone to the point now where there is an act and we're talking about a single payer system. There are many other aspects in the act which I think we agree on. There are obviously areas that we disagree on, but I think the actuarial society and actuaries in general play a critical role in defining the way the NHI will be implemented. And so staying outside of that conversation by simply continuing with the discussion of single payer versus multi-payer is unlikely to actually achieve the objectives I think that we all are looking for. So I would suggest that the Actuarial Society actually appreciate that and come forward and support the NHI. It's better to kind of be within the process and influence the process with the evidence and the skills that you have, than be outside and see decisions being made which you would argue are not appropriate, but you are not part of the process. So those that are making the decisions didn't benefit from your wisdom at that point in time. So I would really encourage you to do that. I think the department as a whole would be very willing to work with the society in order to define this next process, which is actually more critical than the Act, because the Act basically provides a framework, and the framework will be implemented based on what evidence is available, what resources there are, etc., etc. So I think there's a lot that can be gained by you participating in the process as it currently is. Yes, I think there certainly is an actuarial risk linked to utilization. The one risk around the costs are somehow mitigated through the reimbursement mechanism. But clearly, this is a risk that the National Treasury is alive to, because the fund gets its money from the Treasury, and so there would be a huge amount of scrutiny and spotlight on how the fund is performing on a monthly basis, so that you're able to arrest these kinds of problems early, rather than allowing them to progress to a point where you now have to pump in additional funds to be able to deal with those issues. What does fully implemented mean? It's not defined in the legislation, and I think we will have to see how the minister and society appreciates this. But I'm sure at that point, when we get to the point of fully implemented, there would be some engagement that the minister would need to have with the population before saying, well, I've decided now it's fully implemented, so that he or she takes on the views of all South Africans before making such a determination. And I think it will be a very significant step to take. So I don't think anyone would be taking it lightly as such. On the issue about the cups, I didn't quite get the question, but if I understood the bit that I heard,
I can read it again just for clarity.
Yeah? Okay.
What is the governance? And by the way, you should perhaps define cups, because not of you're certainly not talking about this one that I'm holding here. So what is the governance accountability structure for the cups to ensure contracting is sustainable, since it seems that the CAP is made up of the parties that the fund will contract with?
So the CAPS, as I was saying in the presentation, is contracting unit for primary health care. The contracting unit is a tentacle of the National Health Insurance Fund. The CAP at a local level, district or even sub-district level in some cases, would need to establish contracts, because can you imagine a GP or an optometrist or a dentist having to now engage with the National Health Insurance Fund office sitting in Pretoria, wherever that office will be, to be able to everyone's going there to engage on contracts, etc., when they're delivering services in a particular area. So the CAPs are at a local level. They are tentacles of the fund, and they would then get into this contract with the primary care provider at that level, taking into account the type of services that the fund is looking for in that particular area and that they are capable of delivering. And then the question about the Laffer curve and the feasibility of the tax increase. So the fund is not going to define what that tax increase must be, how much it should be, or how the funds that are going to be appropriated are collected. That is entirely a Treasury and a Minister of Finance decision. The Act just identifies the options available to Treasury, and they may well come up with other options as well, I'm sure, in the innovation. And that would be the basis on which it will be funded. We don't really have a role in defining how the funds should be collected. The Treasury is quite averse to earmarking, so there won't be a earmarking of the NHI fund itself. It will be out of the general revenue. Yeah. Hope I've answered all that.
Oh, okay. I wanted to ask, if you look at how the NHI is going to operate, how does that differ with how GEMS operates? So if we were to imagine the NHI being like GEMS, what are the differences in the way in which that would operate? And the reason why I'm saying that is that GEMS, they are a medical scheme. They contract different parties to do different things. How does that differ? Can you maybe try to contrast the two so that maybe we can get a bit more insights into how you envisage for this to work?
Did you mean in the administrative part, James, how it differs in the administrative part, right?
Yeah,
Because
in the administrative part.
benefits and all that are, I mean, it'll be completely different because GEMS operates.
Of course, I understand the structural part in terms of it's a public entity and so on. But if you look at it, it's a fund. Both are funds, right? And both are servicing members. The one is servicing all the citizens. The one is servicing specific members and so on. Yes, there's the collection part, which you don't worry about on this side because you're saying Treasury has to figure that apart. Yes, on the GEM side, they have to worry about the collection part and the pricing of it and all of that. And I understand on the NHI side, you worry more about the benefits, which benefits you're going to be including and so on. So yes, there are differences. But then in terms of rolling out the services, a GEMS would contract with service providers, the hospitals and so on, but it would also contract with the administrators and managed care organizations and so on to do that part of it, the benefit management part of it, the hospital benefit, the chronic medication, all of those kind of things, and then as well as the claims and the administrative processes and so on. So I was just using it as a concept. We are quite familiar with how medical schemes work. So I just wanted to see the contrast, but I understand from a legal perspective and so on, there are a lot of differences there. So yeah.
So in terms of that, those provisions are not defined in the Act, and they would need to be defined through a process, through regulations and guidelines and the like, about how the fund will be operating. But I would anticipate that there are some structures that the fund will need to establish internally, and the Act talks broadly about what those would look like. Administratively, some of those services will be people employed to the fund to be able to do that, and I would assume that a lot of those skills are currently sitting in the medical scheme sector, because these skills are not kind of freely available in government. We don't have such a, or the health department rather, we don't have such a unit, so it's not like we can draw from that kind of base. And then secondly, I think some of those services will be contracted in, depending on the service and the service provider, on the costs, etc. So I think broadly speaking, the fund will need to bring a lot of skills that are currently available within the administrative sector, within the private sector, on board in order for the fund to be able to operate in some of these areas, because these skills are not widely available. There is a defined number of people who would be able to do a particular task. And so I think the fund will be required to do that. But it's not defined anywhere in the Act currently. But I think that these are some of the processes that must still kind of be established. And I suppose once the board is in place, those conversations will need to happen in terms of how the fund will need to bring in some of those skills, and at what level and how that happens, etc. Yeah.
I'm still waiting for questions from people like Peter Bota. I know you're there, and Tandy, I'm waiting for your questions. Anyway, is there, Megan Houston asks, is there a timeline yet as to when the benefits covered will be clarified? Will it be phased in, building the offering over time? That is, I'm going to read another one. It has a preamble, but I'm going to read that. That's important for context. This is from Subidra Reddy. It is very important to provide quality healthcare to all South Africans. South Africa has a well-established public healthcare system. The system is meant to cater to the healthcare needs of all South Africans. However, it is plagued by mismanagement, fraud, and corruption. A very poor track record indeed. The South African government has proved over many years that they are incapable of effectively managing healthcare despite being allocated an extremely significant portion of the national budget. Why would the government be capable of managing NHI effectively? And then the next one. So you are planning something and implementing it without knowing how much, even more or less, it is going to cost. That's the question. And then it says the actuarial profession can certainly assist in this regard. And then Bidra added it to say, surely the solution is to fix the Department of Health first, build more hospitals, build more clinics, employ the 100 of doctors that are awaiting appointment. So Bidra has got very strong views about what you should be focusing on. And then we have seen Treasury reforming the pensions regime in a slow step-based rather than a revolutionary approach. Do you see that as a possible path for NHI? And then Sarika, sorry, somebody trying to call me. Sarika says, hi, there seems to be a disconnect between defining, which is the costing the benefit package, and revenue allocation, which is done by National Treasury. Won't there be a risk of creating a benefit liability that the NHI may not be able to fund? So the disconnect, the fact that these roles are done by different people, will that not lead to a liability that is unfunded? And then, oh yes, Peter. My fear with the Big Bang NHI plans is that our current public healthcare challenges and issues will simply be inherited by the NHI. Is the first step towards UHC in SA not to fix what we already have, and then bringing public and private care closer to each other to achieve our universal healthcare aims? It's a mouthful, so let's tackle those, and we still have 25 minutes to go.
Yes, the benefits will be phased in, certainly, for a variety of reasons. Maybe I'll try and answer the other question as part of that. So the Treasury would clearly not be able to finance a benefit package that is fully comprehensive at the very beginning. And so there's agreement that this will be phased in. I think you may have heard the president talk about this as phases. The minister talks about it as a marathon, etc. So it's going to take many, many years. It's not. It certainly can't happen overnight for a variety of reasons. Budget being one, and the second is that we agree completely that we need to fix the Department of Health's challenges in order for us to be able to implement an effective NHI. Remember, in the presentation, I made the point that the health facilities need to be accredited or certified first by the Office of Health Standards Compliance. So if facilities don't meet the minimum quality standards, they can't be there can be no implementation or contracting in those facilities. So clearly, the intention is that the Department of Health's challenges must be fixed first before we can kind of start with the contracting of those facilities in the way that we envisage. So we're very much on the same page, and we agree completely that that needs to happen. But while that's happening, that doesn't mean there can't be any planning around benefits, etc. Because although we may not necessarily be contracting, there's a lot of work that needs to be done around benefits, around treatment protocols, etc., which will benefit us at the point when we need to start. And we don't want to then wait for us to first have the system in place in terms of the DOH and then think about these other things. So we're trying to do them in parallel as such. Well, look, the question about mismanagement, fraud, corruption, etc., I mean, it's always going to be there. It's something that government will need to prove that it is capable of doing. Obviously, there are a number of institutions in the country that are operating effectively. There are examples as well of those that have been mismanaged. So we're obviously looking at the optimistic side that this is going to be a positive experience for South Africans. And there are safeguards in place to identify where potentially things may go wrong so that there can be intervention. So I think what we need to focus on is what are those safeguards? Are they adequate? Are there other safeguards that need to be built in so that if we identify fraud, corruption, mismanagement, inefficiency, etc., how are those dealt with? Because I mean, as we have humans, we would have all of these problems, and I think trying to put steps in place is probably as important. In terms of the benefit liability, yes, you're absolutely right. The benefit the liability of defining a benefit that cannot be funded is a huge problem. And so the National Treasury, in its appropriations, will be engaging with the fund when the fund wants to declare benefits. So before the fund declares a benefit, there will be a lot of work, and I think the skills of actuaries are key to be able to determine what would be the anticipated impact in terms of the budget, and we'll then need to go along with that and see how it goes. And it's always going to be a case of slow and easy, so that we all learn in the process about how providers behave, how users of the health system will behave, and how the fund will obviously interact with all of that, which influences at the end of the day what the overall cost of the benefits would be. Thanks. I think I've dealt with those.
Okay, let me see if there's one that has come in since we looked at. Okay, this is Sheila Kirika's a friend of mine from Kenya. Instead of and Rwanda, you can choose which one. Instead of allowing medical schemes to offer complementary services only, might it be better for NHI and medical schemes to rather share the costs of provision via the payment mechanism? So, for example, the NHI can cover a capped amount for dental services, then medical schemes can cover any amount above that. That is a supplementary model that works well in Kenya, where I'm from. Maybe you can tackle that one because it was the one outstanding one here.
Well, in some ways, the current proposal is more complementary, because the problem would be if you say that the NHI fund covers up to a certain point and then the medical schemes cover the balance, how would we deal with those that would not be able? I mean, clearly, the entire population will not be able to afford medical schemes. So if they don't have access to that kind of support or cover, they would then be unable to access care because the fund will not be paying the full amount. So clearly that model is difficult to implement in our context, simply because those that are low income earners will be accessing care from a variety of providers, and how would they be able to do that then?
In the media, we've seen counter proposals to the NHI Act, and that seems to focus more around the provision of low-cost plans and so on. What is your take on the counter proposals that are sometimes touted as the solution in the media? What's your take on that?
Well, I think it's important to appreciate that we now have an act. So, whether we like what's in the act or not, it's now the act. And there's only, two ways to deal with it. The one way is obviously challenging it and try to change it through a legal process, or alternatively, work with it to try and shape it to be aligned to what one would believe to be a more workable system where there are concerns about particular aspects. So these counter proposals, I'm not sure how they fit in with the Act, because they don't have the same alignment with the Act. So one would need to then go back and amend the Act to do so. And I'm not sure if anyone in government is at that point yet, having not even implemented any of the clauses in the current Act, to then go away and want to implement something different. So I can't see how that can happen. However, between now and the implementation of NHI, as I indicated, is going to be a fairly long period of time. And there are a number of challenges within the medical scheme sector for sure. And we need to fix those. Many of them have been identified in the health market inquiry. So we've identified within those amendments, or proposals rather, for amendments, etc., of the Medical Schemes Act and other pieces of legislation, what could potentially be implemented in the short term, until we have an implementation of the NHI, because we appreciate that between now and that time, people will be accessing care funded through medical schemes. And where that happens, this is going to be a problem in the current environment. So we're looking at which ones of those recommendations from the HMI we could implement.
Will the risk equalization fund be one of those things that you will prioritize in the meantime?
That would be unlikely, because if you look at the establishment of a risk equalization fund, it would require significant legislative, institutional, and financing to be able to be achieved. And we would need to be persuaded as to why we need to go down that road when we're going down the NHI road. But having said that, there are other measures that certainly one could put in place that would mitigate against some of the problems that currently exist within the schemes environment.
Can you, the single fund model has been chosen, it is the Act, but can you justify it rationally? Why not a multiple pool system? What are the disadvantages of that?
I think those are quite well documented in the literature, where you're looking at a single fund versus a multiple fund. I think I made the point earlier that the multi-payer or the single payer system have their own challenges. So there's no perfect system, and much of this is dependent on the environment that one is in, and what would be most feasible. We've taken a decision that in the South African context, a single payer would be a preferred system, largely because we would need to provide a comprehensive set of benefits to a significant proportion of the population as a developing country. So efficiencies in terms of the cost of administration, negotiating tariffs with suppliers, and a single funder is able to achieve those greater levels of efficiency compared to a multiple fund arrangement. There's nothing to say that several decades from now we may well move to a multi-funder system depending on what the environment. But the environment currently persuades us that a single funder system is probably the best solution for the problems we have right now.
So, I mean, I'm sure that you are not ignoring the economics of the situation. So when you look at doctors, service providers, and so on, are you convinced that you would have a good business case for them to contract with the NHI? And you can look at various levels of doctors, your GPs, and then you can look at specialists. And would it be your objective that when you put a case on the table, that it would be that which would be enticing for those specialists to remain in the country, or you don't care?
No, I think we don't care would not be an appropriate approach, because then I think nobody's the winner. So certainly, I think at an ambulatory level, many of those services, I think we can provide a strong business case that would support that, particularly for your GPs. I think in the case of specialists, we certainly, having sight of the tariffs and the reimbursement rates, etc., that they are involved with, we will need to have a significant engagement about how best we can engage them and get their services. But it's not our intention that they should leave. We need to find a way of working with each other. And I think when we sit down, we haven't had those discussions as yet. So it's hard to predict how they would go. But clearly we need each other. And so we must somehow find each other in terms of how we implement this. Yeah.
And recently the president gave an instruction, or he spoke to the minister to say, no, we must talk to all South Africans and so on. Do you have any insights in terms of what are the issues that need to be discussed with Business Unity South Africa and so on?
Well, I haven't seen what Business Unity South Africa has as a proposal or what they would like to, because I've heard the Business Unity South Africa in the media indicating that they support the NHI broadly, but there are particular aspects that they have concerns about. But I guess when the meeting happens, both the president and the minister will hear which aspects of the NHI they support and which aspects they have a problem with. And I anticipate they may well come with some proposals around that, which I think we'll need to engage with and then understand how we implement that, or how that can be managed. Yeah.
Okay, I've got a couple more questions. Currently, all public patients who have kidney failure are excluded from dialysis treatment if they are older than 60. So will this be extended to the general public when NHI is implemented? Similarly, for cancer treatments, will age be a factor in receiving treatment? Maybe I should just read the other ones. Good day. Earlier on this call, a speaker mentioned the dangers of political interference, and Dr. Pillay mentioned that the rollout would take years and years. Are there measures in place to prevent the politicians from trying to roll out NHI by the next provincial or national elections? And then, are low-income medical schemes a possibility in the short term? And then the last one, there is a shortage of nurses in the country and the private hospital groups are not being allowed to train nurses. Will this supply issue be addressed in advance of NHI?
So the as I said earlier, the benefits package has not been defined. So it would be difficult to say what the fund will cover or not cover. What I can answer is probably what principles they would apply. Clearly, when applying principles to benefit package design, you try to maximize your investment. So in other words, if you are implementing a particular intervention in an individual, a particular burden of disease, what is the likelihood from the evidence that there will be a success? And if the evidence suggests that the success is high and the resources required to implement that are minimal, then you're more likely to want to adopt such a benefit. where the risk is high of failure, and the costs linked to that intervention are high, then you're less likely to want to adopt that. So where does that, so for example, in the case of dialysis, I can give you the example. You may know that there was a case, the Subramani case, which is quite well known. And so the state went through a process of identifying which patients would benefit maximally from dialysis, and as a result, excluded some people and included others. So that would be a principle that will continue to apply. And I think medical schemes apply the same principle as well to a large extent in the way the benefits are defined, because clearly you can take an entire country's budget and allocate it to healthcare, and I'm pretty sure there'll still be people who want benefits that are not funded. So the principle will continue. How can you prevent politicians from interfering and trying to implement NHI in the short term? Well, I think the assurance is the fact that you can't implement NHI without funding, right? So the funding currently is a step that's defined by the economy, etc. And so no matter what you may say or want to do, at the end of the day, that's where kind of the rubber hits the road, right? And if you don't have the funds, you simply can't implement within the timelines that you would like to. I think all of us would like to implement NHI as soon as possible, but we all are appreciative that the economy doesn't necessarily allow us to do that right now to the extent that we'd like, and so we must take those little steps as we move forward. Around low-income medical schemes, well, I mean, low-income medical scheme options certainly have been presented. The one challenge thus far has been that all of the benefits that have been suggested have largely not taken a comprehensive approach around the way they've dealt with the offering from the ambulatory side, at least. You know, so many of them have been structured largely around providing ambulatory care. And if you look at the ambulatory care cover, they've been fairly limited or sparse relative to what they could be, because I anticipate that the providers are not of the same mind as those that are putting the package together. And so we need to have a conversation with providers. If providers are serious about providing this, then we need to have alternative tariffs for these low-income groups so that they're able to access a set of comprehensive benefits. But that has been where I think the problem has eluded us, if I can put it like that.
I wanted to ask, we've got about 6 minutes. The pilots that you ran in sort of a primary healthcare setup, I think some reports I've seen is that those were indicated like spectacular failure. But what lessons did we learn from those pilots?
I don't know why they would say they are failures. So they were not pilots of NHI. They were pilots of health system projects that would support an NHI rollout. So they were not testing NHI per se. So you can't say whether the NHI will succeed or fail based on that. So, for example, we implemented the centralized chronic medicines dispensing and distribution, where we got in private providers to distribute chronic medicines for patients, where they collected it at a point closest to their home. And that system works very well. It's won a number of awards. It's cost effective for us. It's more efficient for us to do that than the traditional way we provide medicines. So there are a number of those kinds of examples of projects that we did. And so I think over time, you will see other innovations coming to the fore. I mean, technology is bringing options to the table of, virtual consults, etc. AI is also going to make a contribution. So I think when we're thinking about the NHI delivery platform, it's important to also appreciate that the health sector is also changing with all of this innovation. And this innovation brings with it efficiency and lower costs, which help in trying to develop a broader benefit package for all South Africans. Yeah.
The question around the nurses was not answered. There's a shortage of nurses in the country, and the private hospital groups are not being allowed to train nurses. I'm not even sure whether that's true, but anyway, will this supply issue be addressed in advance of the NHI?
Well, the supply issue certainly needs to be addressed. There is a human resources for health strategic plan. It's on our website. And in that plan, it clearly indicates that there is certainly a shortage of skilled nurses. So we have a semi-skilled nurses in sufficient quantities that, and I don't think the focus needs to necessarily be at that level. Our focus needs to be on the more specialized nursing skills, or that are often being poached from us, by other countries. And I think that's the skill that we need to develop and focus on, because if we are going to offer a comprehensive package, we need to have those skills available, particularly in our hospitals.
We have 3 minutes, so closing comments from you. Perhaps just to emphasize the things that need to be demystified about NHI, as well as maybe a call to action. What is your message to us as a profession and those of our friends and other policymakers that are in attendance? What is your message to us?
I think firstly to say that the NHI is going to be implemented in phases, and it's going to be a stepwise approach that is very mindful of the resources that are available. So there won't be a big bang. That many of the provisions that are in the Act are largely framework provisions. Many of those details have not been finalized. And so I think the Actuarial Society has a huge contribution to make and can certainly influence the way that many of those details are then structured as part of that process. So I would really invite the Actuarial Society to work with us as we go through these various steps of implementation, even working through how we bring the public health system up to speed in terms of the many challenges that it has in order for it to be NHI ready at that point. So I think as we speak, not only about the NHI, but the current health system and bringing that up to speed, I think is important. And I think working together probably is much better than you staying outside and hoping that you can influence us in that way. It's much easier to influence us when you are part of the team as such.
Loud and clear. So to my colleagues, I think the message from the health department is very clear. The call to us as a profession to engage with these issues. Dr. Anban, I would like to thank you for your time. I think it was hectic. You fielded a lot of questions, but you responded, I think, fully to these questions. So I really want to thank you for your time. And if there are any opportunities to engage with the minister, we can, a group of us can certainly make ourselves available for those engagements. So thank you very much.
Thank you very much. Thank you for the opportunity, and all the best. Thanks.
Thank you. Yeah. So at this point, I think for me, thank you very much for attending. There is a workshop that is going to start at about 2:10. Stephen Walker and his comrades are going to be in charge there. So you are invited to attend that. Very big issues that are going to be discussed there. But up until now, I mean, there's still about 70 of you. It's been good thus far. So let's continue in the afternoon. Thank you very much. Now it's lunchtime. Thank you.
through that. Tawanda Chituku is an actuary and entrepreneur based in Zimbabwe. He's much of a generalist with interests in social security, insurance, IFRS 17, and investments. We have Megan Carswell. She's from the School of Statistics and Actuarial Science at Wits University and specializes in pensions and social security. Then we have Alex van der Heever. He's the chair in the Social Security Systems Administration and Management Studies at the Wits School of Governance. And Rob Rusconi, who is an actuary, independent researcher and consultant who's worked across most of the actuarial fields. He was part of a team that assessed the options for retirement provision for informal economy workers. And as part of that project, he carried out some research into the attributes of this group, which is not that well known in the formal sector economy to the majority of us. So a great panel, and we're hoping for a lot of discussion, debate, and to add some thinking into possibly the preconceived ideas that some of us have in these complex topics. Stephen, do you want to kick us off with the what's been happening in private pension provision in the last couple of years?
Okay, thanks very much, Joanna. I'm just checking you can see the slides, you can hear me?
Yep.
Wonderful. All right, so Joanna is going to strictly keep me to 15 minutes. So in 15 minutes, I'm going to try and encapsulate a heck of a lot of history, trying to position where we are now in terms of retirement reform and where we think we're going to be going to in the near future. So my focus for the next 15 minutes is going to be very much on tiers 3 and 4. In other words, the occupational retirement funds and the private pension policies, voluntary retirement savings, where the majority of us pensions actuaries find employment. But it's not to say that we believe that this is the entirety of the pension provision. So the next larger part of our session is going to be the panel discussion, which will cover tier 1, especially with a bit of tier 2. So please don't think that this is me now saying tier 3 and tier 4 is everything. We realize that they're not everything. So I showed Joanna my slides, and Joanna absolutely hates my slides. She says they've got way too much information. I'm not going to literally read every single last little bullet point. I like to give out lots of information and then let the people read through this in their own time. I just want to touch on what I think is relevant and important. So in South Africa, we've had a very long history of retirement fund provision. So I work for Old Mutual, for example. Old Mutual had a staff pension fund already from the 1920s, just as an example. And even from the late 19th century, the 1880s thereabouts, was the first time that we have a record of an occupational retirement fund being set up in South Africa. And even our Pension Funds Act of 1956 was one of the very first pieces of pension legislation of its sort that was issued in the world. So historically, we've come from this space where we had the pension funds, provident funds, the retirement annuity funds, and now in our new world, we're moving towards streamlining and having one type of retirement fund that covers everybody. So we're going to talk about that a bit more. Historically, what we saw was that provident funds dominated membership. So until recently, provident funds represented 2/3 of occupational retirement fund membership, and more was going towards that route. So we obviously saw this massive change from defined benefits to defined contributions, more and more going towards DC, more and more towards provident funds. We've never had compulsory pension preservation in our history up until the 1st of September, except at the retirement annuity fund level, which was for individuals. So now with occupational retirement funds, we're now living in a new world from the 1st of September where this is the reality. And what I find so interesting is that organized labor only got involved with retirement funds in the early 80s to fight against the apartheid government's plans for introducing compulsory pension preservation. And so now it's interesting to see how the current discussions and debates at NEDLAC are taking us forward into this bold new world when it comes to pensions. So we previously had 2 amendments to the Pension Funds Act, which were about ensuring member representation, was ensuring minimum benefits. But that brought us then into the 21st century, where at the beginning of the 21st century, we found ourselves in a position where DC funds had now replaced DB funds, commercial funds were starting to take over. And we then had government wanting to get more involved. So there was this speech given in 2012, which led to a lot of reforms that have happened subsequently, where government was looking at the current pensions model in the country and saying, where do they believe is the room for improvement? So where are we failing? So low levels of annuitization, low levels of preservation, not enough savings, the high fees that this private sector is charging. And so a lot of the reforms that have been driven subsequently have come out of that viewpoint already expressed in 2012. So there have been, this is what Andrea always says, and I always quote her, that there's been a lot of debate, there's been some false starts, but we are making progress. So if you look back over the last decade or so, or just over a decade, the reforms that have been coming through have been significant in terms of where I started working in pensions about 25 years ago. So I worked through the impact of the Pension Fund Second Amendment Act, and subsequently we've seen a lot of changes coming through this pensions world in South Africa. The big one for me was definitely the phasing out of provident funds. So already in 2015, 2016, there were these attempts to start phasing out provident funds, to streamline the tax treatment of contributions, to introduce new incentives for people to save. And some of these changes came through, but there was a lot of resistance to the phasing out of provident funds, because like I said, the vast majority of members, more than 2/3 of workers in retirement funds, were in provident funds. Provident funds were very, very popular. Cash is king. People like to receive 100% cash at the time of retirement. And 2020, COVID, I think, changed a lot of things. So I was placing bets, would the phasing out of provident funds be kicked down kicked into touch again and kicked down the line, pushed out? No, it actually happened. And so some of these changes now that we've seen are just boggling my mind personally as someone who's worked in pensions for 25 years, that where we're going to is completely different to where we're coming from. So in December 2021, we were coming out of COVID, and National Treasury issued discussion papers on 3 very important retirement funding concepts. So number one, which I'm going to talk about a bit today, is the two-pot system, where we came up with this approach. And initially, this was from us actuaries. I can remember in 2019 talking about this concept that we should have maybe more access and then introduce compulsory preservation. But how do we do it? Should we do it with a tax-free savings account combined with a retirement annuity fund? And then in 2020 at NEDLAC, when people started mentioning this as an option, suddenly it became a very popular idea, and it has actually happened now in our lifetimes, not too long thereafter. Auto enrollment is this idea of people in the formal sector being required to contribute a minimum amount towards retirement savings, because we also are one of the few countries that don't have any sort of compulsory retirement savings. And then governance. Treasury has raised issues and concerns specifically about commercial umbrella funds. There's a lot of debate there about, okay, but aren't you introducing too much governance with too much fees? You complain about our fees and you want us to do more governance. So that's an ongoing debate. We'll still also see what comes out of that in terms of where Treasury believes we should be moving towards as SA retirement funds. So in terms of two pots, the idea, as I'm sure most people are aware, if not everybody, unless you've been living under a rock, is aware by now, that it may be called two pots, but it's actually multiple pots, because we split the vested entitlements, the previously accrued entitlements, and those old rules still need to apply. So an individual could have a vested pot of provident fund money, a vested pot of pension fund money, and the old rules in terms of withdrawal, in terms of retirement access, still apply there. But now from the 1st of September, we've got this concept of a savings pot, which is horribly named. I would have preferred to call it the emergency savings pot or emergency access pot, something to discourage people from just willy-nilly taking it out, because that's what we're seeing right now, that people are just trying to grab their money as soon as possible. And what I've been saying to individuals who, as actuaries, are coming to me to say, but why as the Actuarial Society have we supported two pots right from the beginning? It's because we're now for the first time living in this dream world of having compulsory retirement savings in terms of the retirement pot. So unlike the past, where if you change jobs, you could take out 100% of your cash, and people generally did, and spent it on anything and everything except actually saving for retirement. Now going forward, 2/3 of benefits accruing have to be preserved until retirement. So there were some debates about the seeding capital, the access to the accrued benefits. That's now been limited to 10%, capped at 30,000 Rand. I'm sure we're aware of this. We have seen that there's been many, many members who've had less than 2,000 Rand because of the fact they've got less than 20,000 Rand. And 2,000 Rand is that minimum withdrawal. And one of the things I've been interested to see is the number of articles where people haven't been aware of the fact that their employers have not been paying contributions over. There's all sorts of requirements in terms of whistleblowing where we're supposed to, as the industry, have reported such cases. But the fact that it's now when people are trying to get hold of their money that this is coming to light, I think, okay, at least there's something good coming out of this, where now employers are being actually shamed, named and shamed and forced into paying contributions that are payable into the retirement funds. And also we find that at least the communication avenues are improving now, because everybody wants to give us their contact details, their cell number, their email address, everything, because now there's a financial incentive. So at least we can communicate better with our members going forward. There's still ongoing debate, you also would have seen in the media, in terms of the trade unions now saying, but they're not happy with this two pots version. Some are saying it's it's okay, there's room for improvement. Others are saying it's not okay because there's massive room for improvement. What I found interesting is that some of the ideas that we put forward probably 2 years ago as the Actuarial Society has now been taken up by such critics, including the fact that we should be allowing members to move more money from the vested pot into their accessible savings pot, but that's only if they double up and put twice as much into the compulsory savings pot, because we are really keen believers on compulsory savings and compulsory preservation, I should say. And not only that, but we also believe in having an exception, an exemption. So although we're massive believers in compulsory preservation, we also do believe that with our current social security system, it doesn't help people much if they're starving to death in the streets, but they've got money that's caught up in this retirement fund that they can't access. So we do believe that some sort of exemption should be available, and not necessarily paid out in a lump sum form, but perhaps paid out over a period of time. And what's been said is that, guys, this is the model as it is. There's going to be future reforms. And so watch the space. There will be future debates about the retirement reforms that are going to be implemented on both tiers 3 and tier 4. So I've also got some slides. I'm not going to spend a lot of time on this in terms of what we would call auto-enrollment, which is more similar, I would say, to the superannuation system that they've got in Australia, where everybody in the formal sector will be required to contribute to an approved savings vehicle and at a minimum rate. So what is that minimum rate going to be? Well, I don't know. So we've got different examples here I've cited within the continent, the UK with their auto-enrollment, which is not exactly the same as what we have in mind. I mean, they've got a minimum rate of 8% in total, which I would still feel is too low. We normally talk about trying to have 15% net going towards retirement savings. In practice, you've got probably about 10%, 11% net on average going towards retirement savings. So it remains to be seen what exactly would be affordable. And in Kenya, where they've recently introduced this, there's been a lot of pushback from companies saying, no, but we've never had to do this, so now you're forcing us to do this, we can't afford it. And the companies are required to pay 6%, and they're saying they can't. So how exactly this is going to happen, where exactly this is going to happen, we don't know. But this is something that we look forward to as the Actuarial Society that will also make a significant change, is if we are requiring people in the formal sector to have this minimum savings towards retirement, especially in light of the fact that they're now going to have 1/3 early access versus 2/3 compulsory preservation up until the time they retire. So we realize that the formal sector is a minority of people within this country overall. We've got high unemployment, which we're going to speak about next. We've got some people working in the informal sector, but at least this would be a start in terms of improving matters for the formal sector. And afterwards, we would be looking at the informal sector. So one thing that I think about a lot is the fact that our state old age grant is so fundamentally important to so many people in this country. So more than 2/3 of people aged over 60 in this country receive the state old age grant, and it makes a significant difference in their lives. This is something that took me a few years to realize. But without that state old age grant, this country would have fallen apart, I think, because the gogos out there are supporting grandchildren, looking after grandchildren with their state old age grant money. So I think it's a massive source of peace and support in this country, not just the other grants payable at younger ages, like the child support grant, but even giving the seniors in this country enough money so that they can actually try to survive and support the younger people, I think makes a big difference in lives. So I always think personally that the non-contributory pensions are going to be fundamentally important to the informal sector. We're going to have this discussion now under the panel in terms of the use of grants for unemployed individuals or the largely unemployed individuals. What I found interesting looking around in other African countries is you see these examples of pension products designed for the informal sector, which are there to encourage people to save, which actually by design sound more similar to our 2-pot system or 3 or 4-pot system, however you want to call it. So it's going to be interesting to see how we can also follow the examples of some of the other African countries that have been doing this for quite some time. How do we build suitable savings products for the informal sector? But I think ultimately the non-contributory tier 1 pensions are going to remain so fundamentally important. Now, Joanna, I think I've got about 1.5 minutes to spare, so you don't have to shout at me. Are we ready to hand over to our panel, Joanna?
Well done, Stephen. Yes, thank you very much. So basically, quite a lot of change has happened in the last couple of years where we've now got the much needed compulsory preservation. We've got the compulsory annuitization as well. So just the auto enrollment to make almost like what looks like almost what looks like a national scheme, but that's privatized. Can I say that?
No, that's a controversial statement you just made, Joanna.
Yeah, okay.
Please
Okay,
tread carefully, Comrade Joanna. Thank you.
Let's keep away from those then. The topic here, let's flip to the other side of the spectrum. So besides voluntary private provision, on the other side, we've got this problem of unemployment, the unemployed, the role of grants, a lot of conversations happening about the basic income grant. And I think what we want to unpack and discuss in the rest of the session is really what kind of solutions are available, and which solutions solve which problems, the merits and demerits of the introduction of basic income grant given our unemployment stats, and just to unpack what it is that we're trying to solve and the possible solutions available. Firstly, perhaps it would be helpful if we could identify the unemployment. So in other words, define what it is, what it means, and what kind of statistics are we dealing with. Megan, would you be able to help us to understand that? You're muted. Great. You still muted?
And now?
Looks good.
Excellent. So when we define the unemployment rate, we take the number of unemployed and we divide by the labor force. Okay, now the labor force, generally speaking, is the population of working age with some adjustments. The population of working age internationally is defined as people between the ages of 15 and 64. Now, I know that some of those people who are age 15 are going to still be in school, and some of those people who are age 64 are going to be working. And in any working age population, they're going to be people who don't want jobs, who are not looking for jobs, including people still at school or people who have retired from work. There also might be people who are employed who are working within the home, so in caring positions, or who simply might be very wealthy and just don't need or want a job. So these people are termed the not economically active population, and we take them out of the people of working age to get the labor force. So who is employed? It's fairly easy. These are people who have jobs. We can define them in 4 different buckets. They're people who work in the formal sector. These are people who pay taxes, who are protected by labor law. And in South Africa, we have about 11.5 million of these. Then we have the informal sector, which are people who don't necessarily pay taxes and who don't necessarily have the full protection of labor law. So the UIF or cover by COIDA, for example. And then you have people who are working in agriculture. Those tend to be very seasonal jobs, and people employed in households. And agricultural and household workers often fall a bit between the formal and informal sector. And if we added those all together, we would have 15 million people who are employed. So if we took basically everyone else and divided it by the labor force, we would get a broad definition of unemployment of 41.9%. Now, this is probably the highest unemployment rate in the world, and it's been increasing in recent years and in recent quarters. So this is an obvious point of concern. One of the speakers earlier spoke about unemployment as being a prison without walls, and it is a very, very, very big social problem. Now, the official definition of unemployment is a little bit lower, and what that does is it looks specifically at people who want jobs, but who are not actively looking for them. Now, in South Africa, that's between 3 and 4 million people who fall into that bucket. So the official definition of unemployment actually takes those discouraged work seekers out of the labor force as well, and it doesn't consider them to be unemployed. And that gives us an official unemployment rate of 32.9%. Again, a very high number by international standards, and it's a number that has been increasing. Now, there are a couple of caveats that we need to put around that number. So these are the numbers produced by Stats South Africa in terms of their quarterly labor force survey. So it's a sample. And as good actuaries, we know that, you don't necessarily get a true reflection from a sample, particularly if it's a small sample. And the second issue to just be aware of in terms of unemployment statistics is that employment in the informal sector is typically underreported. The reason being is that sometimes people in the informal sector don't want to pay income tax, or they want to avoid getting involved in social insurance. And so they want to keep below the radar, so they don't actually report that they're earning an income in the informal sector. So for that reason, we need to just look at these measures with a pinch of salt. These are estimates of our unemployment problem, but our unemployment problem is still highly significant and has been a growing problem over many years.
Okay, thank you. Thank you very much. Sorry, I'm aware that there's a problem with my video. I think I don't know how to fix it. So maybe when somebody else is talking. Megan, thank you for that. I mean, I know it seems like it's an obvious problem because we want people to be employed, but obviously the problem is that they don't have income if they are not employed. But I think that there's a bit of possibly consequences to unemployment that we don't often necessarily think of up front. Alex, I think you have some experience and have done some work into this. Could you maybe talk us through kind of like the actual problems with unemployment and all the various problems that we could be trying to solve with the different tools that we have? Because
Yes,
it's not
thank
just
you.
a problem of people not having income. I mean, there's a bigger problem with the fact that people don't have work.
So so first of all, can you hear me okay? I'm working on a laptop with new audio, so I haven't tested it. So I hope you can hear me fine.
Yes.
So I think the issue to understand is that there is actually a multifaceted set of problems that you deal with. And the danger in looking at policy solutions is really just focusing on the one and not understanding that there are implications for the others. So if we had to look at unemployment in itself, unemployment in South Africa is stark. The actual levels of formal sector unemployment, the people not employed in the formal sector, are very high. And informal sectors and informal work tends to be low productivity labor, and it's not a very productive part of the economy. So although it allows some people to survive and derive incomes, from an economic perspective, it's actually pretty weak. So there's the issue of employment, but employment and formal employment is related to the overall levels of economic growth. And if South Africa has experienced weak economic growth for over a decade now. So it's sort of roughly just under 1% per annum. That's problematic. And that becomes a cause for a whole lot of other problems. So unemployment, just by having very high levels of unemployment, we generate inequality, income inequality, because some people are earning and others are not. And so this is a problem that we have to solve at the economic level. It's not going to be solved with specific social policy instruments. And I want to sort of then talk about what problems, social instruments attempt to solve in this kind of context. When we have unemployment, we have poverty, and we have extreme levels of poverty that emerge. And you're going to have people who are essentially socially excluded due to an absence of income. This is quite deeply problematic. It's toxic for a society. It destroys social cohesion. It basically creates people who regard themselves as outsiders and enemies of the people who are insiders. That's the consequence of a breakdown of social cohesion. So in the language of social contracting, the social contract starts to break down, society becomes more fragile, even democratic structures that have been built up over time start to fail. And you have increased levels of violence that start to emerge and massive dissatisfaction in society. So you have all sorts of knock-on effects that become where it becomes more and more difficult to control what's happening in society. And so this poverty link inequality, just inequality on its own, has an impact. So even if people are surviving, the mere fact that there are large differences in income and wealth between people creates a social cohesion problem on its own. So poverty, inequality are distinct problems in society. So the social grant system as an intervention and non-contributory systems are quite crucial to attacking poverty, but they don't necessarily make a huge difference to inequality over time. We cannot do without the system. And we recently introduced the Social Relief of Distress Grant, and it was only introduced in South Africa because of COVID. Otherwise, government wouldn't have introduced it at all. We would still be leaving a huge income support gap for the people 18 to 59. Now, the problem comes forward, it only mitigates an aspect of the poverty problem and the hardship that people face. It can't really solve inequality, and it can't really generate at these levels social inclusion. The problem is that the grant system can't be increased faster than it is, because we're also tied up. What also gets impacted when economic growth is weak is that tax, what we get in government revenue is obviously constrained. And there's been an assumption, a discussion with the sort of social grant discussion that assumed that you can just increase tax rates to claw in the amount of money you need to kind of make up the difference between a substantial grant and what we have. The reality is you can't. South Africa is basically at tax capacity, which means that if we increase tax rates, we would probably have a drop in revenue. So our only way to increase government revenues for the purposes of redistributive spending is through economic growth. So a central issue in South Africa is to have that economic growth work. But in terms of our social security instruments, it's actually important that we build the institutions that create a connection between the support structure, the income support, and labor activation strategies. And these are areas that we need to invest in. And unfortunately, South Africa has developed weak public institutions and organizations, which means the level of sophistication required to link parts of our social protection regime are difficult to set up. And we need change there. But in itself, it's not going to change the systemic problem. Economic growth has to return, but we need strong public institutions, and the build-up of redistributive support to fund basic income allocations is going to happen incrementally. So we are going to be left with many of these high-risk scenarios in South African society for quite a while. So we do have to be very careful, but we do have to progressively implement a policy framework of general support to people overall. Sorry, so that's sort of a bit of a mouthful, but I hope I've kind of given an idea of the sort of the problem and how to begin thinking about the solutions.
Yes, thanks very much. I mean, that's useful because we often think about kind of unemployment and just getting people out of poverty, as you say, but as you point out, it's not doesn't necessarily solve your social kind of inclusion and inequality issues that then have societal repercussions. That's what I kind of gathered from that.
So just to make clear, you can have so economic growth will generate improvements in employment. It might not solve steep inequality problems. So all countries balance that out. So all high-performing countries also need to have a redistributive framework in place to correct imbalances that are generated just automatically within the marketplace. But we've got a problem that's deeper than just that. We've got a systemic problem in creating employment. We've got to get growth back. And when we get growth back, we've also got to deal with the structural inequality that results from normal economic activity. It doesn't have to be disruptive to economic activity, but it needs to be balancing in order to create a reasonable degree of social cohesion, to move away from a sort of fragile, toxic social context.
Okay, thanks for that. I mean, in our discussions about the grants specifically, there was some talk about what have other countries done. Can grants be, for example, made conditional, the food for work programs? Tawanda, I know you've done some work around what other countries have done. Would you like to just quickly share with us what other countries have done in terms of programs around their grants? So it's not necessarily a grant that is collected, but there's a program around that. Would you mind telling us about those.
All right. Thanks, Joanna. Thanks, everyone. Can you see me? And can you hear me?
Yes.
Okay, awesome. So I'm going to give you a bit of history, interesting history about how Zim has handled social security, social welfare, and handling this issue of grants to alleviate poverty and to empower the impoverished population. It kind of goes back to the 1800s. This is for Zim, Zambia, and Kenya. You find that we had the same sort of approach to community welfare, which was driven by chiefs. And in the olden days, what used to happen was the chief would set up something that is called, in our language, it's called a nimbe or a zunde. All right, never mind what the word means. It's a Shona word, or it's Swahili word for people coming together. The chief puts together a pot of food and some traditional brew. People come and enjoy themselves, and then they plow the fields and they plant and harvest or weed the fields, and then the harvest that the chief gets is basically earmarked for people that are known in the community to be widows, orphans, or travelers who are sort of stranded. So this was how it was done all the way up until the 1960s, when urbanization kind of kicked in. And you find that there was a split between how social welfare and community welfare has sort of been administered and handled in the rural setting and in the urban setting. And mind you, Zim has a population of 15 million, and you will find that about 9 million is in the rural, and about 6 million is urban. So very significant and very important setup and system in the rural areas. And the government has kind of adopted that rural setting. So what you find with the current government, they won't do what the chief does. So they're not going to do an illicit brew for people to come and till a field. But they've come up with a food for work program. And the key driver for this is we, as a country, have been running massive budget deficits with no latitude to raise tax or to mobilize more income. But what has come through in Zim particularly is a strong presence of non-governmental organizations who have funding for example, building hospitals or building schools or building bridges and roads to increase access and movement for farmers to move their produce. So, for example, you have Clinton Access Initiative, and they will have funding only to build a ward in a particular area. So the government cannot take that funding and address other needs. But what they do now, with agreements with the NGO, they will get the community to come and work at the hospital or to do up the road or to do up the school. And they'll basically use the same funding which was earmarked by an NGO to achieve a certain outcome. They'll use the same funding to basically pay these village workers. And this has been going on since the 80s. And recently this year, actually in May 2024, the Minister of Labor launched a similar program because we've had quite a terrible drought. So you find the Minister of Labor actually launched a similar program. So there's food for work that is actually going on, and it is mobilized around the same activities, repair of hospitals, repair of roads, and that sort of thing. Now, there was even an interesting initiative that I saw at one hospital, which is called Howard Hospital, and the donors, which are the Salvation Army, agreed with the community that the community will then maintain the place. They will upgrade or sort of renovate whatever needs to be done. They'll build toilets, they'll cut grass and so on. And for that, on the one end, the same hospital allows members of the community to pay with livestock. So if you have a goat, you can bring a goat to the hospital. They will either use it for consumption in the hospital, or you can bring a chicken, which is valued at an amount that is kind of arm's length agreed in the area. So you bring that. So either it's consumed in the hospital, or when people come to work, they're actually then given some of this stuff as payment, and that has kind of sustained those communities and very popular. The downside is that there's a bit of means testing. All right, so for you to participate in the food for work programs, there's a bit of means testing. So there's a book that is maintained by the chief, and the chief has to confirm that you are indeed, in quotes, you're poor. So a lot of people kind of shun that system. They end up not taking part in it and looking for other activities. But that is how it has been done. Very successful, I believe, by many measures. Now, as you move post-independence into the kind of formalized and urbanized population, you sort of have a two-pronged approach. I don't know whether it's by design by the government or it has sort of just emerged out of what has been practical or what was achievable. The first is the compulsory provision of pensions by the government through the National Social Security Authority, and all employers are required to pay for that, and all employees are required to pay for that. It provides old age pension, disability pension, and compensation in the event that you basically are injured at work, and all the other kind of covered conditions. The second layer, I don't know if I'm going to call it a layer or sort of program, identifies groups. So it's got, number one, just people who are considered poor, right? For whatever reason. These people are poor by whatever measure is adopted by government. It identifies young people who are of school-going age, but are not able to access quality education and all these other services like quality healthcare. It also identifies people who have left school and are actively seeking for employment. Then it's got your orphans, HIV patients, and that sort of stuff. Now, our government, instead of going to give out cash, it has waivers for certain services. So you find in Zim, to attend primary school, the fees is like $5 for certain areas. And for simplicity, I think the government has just identified this area is basically from people who do not have means, so we're going to charge $5 for people to go to school. Some schools are free. And then they've identified, for example, maternal health is free in Zim, all right? So they've made sure they don't have the time to check whether you're rich or poor. If it's maternal, you're basically not going to pay anything. If you qualify for that as well, the clinics and the hospitals in those areas will be free. Never mind the fact that you then don't get drugs and all the other stuff. Coming on to now university, all this happens from sort of grade 0 to Form 6. There's some sort of criteria that they use to administer this. Come to university, they used to have one of the best university grants in Africa, but people abused, they didn't pay back the government, and that program was discontinued. But it was so good because it just allowed anyone with good passes at A level, you know you're set. You go to university, everything paid for, and you know you basically sort of be able to upgrade yourself, no limitations. Now they're looking at what do they do with the guys who have finished university or the guys who have finished A level. There's some programs that are they launched what they called the Youth Fund. This is around 2012, 2013. They called the Youth Fund. A young person, do a business proposal, go to a bank. I think Old Mutual was the main funder and the main guarantor of that particular program. You go to a bank and you get $5,000, and then the field officers will then go and support you basically in that program. So it wasn't a grant as such, but it was access to cheap funding and basically funding. The pot was 20 million US. It was run down and discontinued, unfortunately. And then the sort of...
Thanks, Wanda. I mean, I think that the question that I have is how scalable and how sustainable are the measures that the government would have put in? So it's all well to say, okay, well, the NGO is now paying us this money and we can allocate it, but how sustainable are those interventions in terms of over time not creating kind of like a dependence of the state on an external party?
Yeah, I find the fragmentation to be problematic because if you're not in control of the source of funding, which in many instances has either to be a tax base, which is your income tax, or your VAT base, if you're dependent on third parties, number one, and those third parties are fragmented. So you have USAID with its own programs, and they'll have their outcomes that they are targeting, which are not necessarily financial. So USAID may target that, for example, we want to support the HIV program until the HIV prevalence rate is 5%. Once they get to that, they cut off and they say, we've done our work and we're going. And if you use that to drive a program, then it means you can't scale it up. You sort of wait to hear how much funding is there, and then you become reactionary. But the one that they set up that has been quite good is the HIV response plan, which is text-based and gives free ARVs, free treatment for orphans. And that one has actually been scalable because they have capacity to raise the tax rate in Parliament.
Okay, thanks very much for sharing the those experiences, and it's quite interesting to hear how different countries, and I think we do need to, we mentioned that in our preparation talk with the panel to make sure that the problem that you're solving is country specific, because it will be different problems that you're trying to solve in different ways, and sometimes you do have to be a little bit creative, as we heard in the rural hospital payment from Tawanda now. Coming back to South Africa and the grant system, Megan, you've done quite a lot of work in this area. Could you just talk us through what the rationale is, and also this perception that there's perhaps dependency created by grant or discouragement for work seeking? Do they actually work? Conditional grants maybe, or working for grants? Like just talk us through whether the grants would be a reasonable way to handle some part of the problem. I mean, we've heard from Alex, they don't solve the entire problem, but they do at least kind of provide a poverty alleviation tool.
Right. So I think it's important to remember that grants form part of social security, which is essentially the safety net for society. They're not there to solve unemployment, but they are there. They can ameliorate the effects of unemployment. So they weren't designed to fix unemployment for a start, and they can't solve that problem. Okay. But as you say, there's sometimes a perception that grants and social security, particularly if we don't link it to someone having to go out and find a job, that it can actually make unemployment worse. In the South African context, that isn't true. Our grants are paid at a relatively low level. They're paid to a lot of people, which is why, as you know, from a budgetary perspective, grants are pretty big. But at an individual household level, the amounts received are fairly small. So they tend not to discourage people from going out to find jobs. And in fact, when research was done on households receiving the child support grant, the households that did receive the grant were much more likely to actually go out and try and find work and ultimately, you know, gain employment than equivalent households who didn't. And the reason being is that actually finding a job costs money. You need taxi fare, you need data. You know, there are plenty of costs involved in that, and the grants can be helpful for people who just need that little bit of breathing room to actually go out and try and look for work. So they certainly don't make the position any worse. As Alex said, they can go out and they can ameliorate, they can ameliorate some of the the negative effects of unemployment, but it's certainly not a problem that it was designed to fix. And in fact, if we look at our grants, they have been very useful in reducing poverty and inequality, but they haven't resolved the problem completely. So for example, if we look at the child support grant, it's very helpful at moving households out of poverty. But if we look at kids who actually receive it, once that grant stops being paid, those children are no better off, now young adults are no better off than equivalent young adults raised in households without the CSG. There's no sort of lasting effect. In addition, our childhood stunting rate has remained pervasive, it's between 20 and 25%. Despite the expansion of the child support grant, both in terms of age groups to which it's paid and in terms of the amount that's paid. And one of the reasons for this is that there are too many users and uses of that grant money. So the grant is coming into a household and there are a number of people who are relying on it as a part of income. So the grants could be much more effective if unemployment were so high. And, to put it differently, the grants can't solve unemployment because of unemployment, because it's so high and because they were just never really, intended to solve for this problem. I think Alex is in a good position to comment on the conditionality of grants.
Alex, do you want to pitch in with how about making grants conditional?
Yeah, so conditionalities can be considered when you've got a relatively a large payment, and a payment that might actually make somebody passive. So the whole idea of conditionalities is potentially to link a grant to some form or income support to some form of positive program that would be uplifting. So on the one hand, conditionalities might be linked to labor activation strategies, depending on what they are. The other conditionalities might be linked to requirements for people to attend antenatal care or to attend school. So if you've got a supply problem in one of the other social programs, such as education or healthcare, you might create a conditionality to compel somebody to do something otherwise they might otherwise not do. But there are huge. It's quite controversial because in many cases there might be valid reasons why people aren't actually using other services. And it might not be that it is that they're doing it because they are short-sighted. And so what you're now doing is actually taking away their grant because they actually can't access something for some other reason. So conditionalities for really low levels of social protection are not recommended. But what one can do or understand is that there's probably a layer of unconditional support that makes sense. And then there's a layer of support for which there might be increasing levels of conditionality, one of which might be that you contribute towards it. So contributory systems are that you only get this entitlement if you contribute toward it, so social insurance. And others would be, but where you're getting social assistance, in other words, non-contributory support at a very high level, you might want to say, well, we've got this captured group, we know who they are, let's give them beneficial access to labor activation programs, skills development, access to some form of access to employment, lowering the cost and the cost barrier to finding employment. So job seeking is really, the costs and barriers are reduced. So on the one hand, you could look at conditionalities as actually trying to achieve linkages rather than actually placing conditions on people who are in any case quite disadvantaged. And you don't always have to have a penalty design structure in order to create these linkages. So we in the case of Brazil, where a lot of these conditionalities were introduced on grants, it was done as part of essentially a political settlement, because there was a conservative government. There was a sort of conservative backlash to the idea of paying grants. And so people made them conditional in order to make them more acceptable. So there wasn't any research done on dependency, etc. It was done just to get it through. I don't think that we should look at it from that perspective. We should look at something that makes a difference. I just want to make one comment on on social support structures at scale. You can design your systems to be nothing more than some form of risk mitigation, basically a minimalist framework that just keeps people from dying. The other approach is basically to see them as part of a positive process in which you try to achieve systemic effects going forward. And that means that you've got to do things at scale. So currently South Africa we've got grants at scale, but not sufficient to have systemic effects. We can't afford to do at levels that will have a systemic effect, and we don't have the support structures in place to achieve some of the efficiencies that would be required, like linkages to labor activation. We need to build those, and we need to progressively improve them over time so that we do get systemic effects. We shouldn't really be just looking at a minimalist framework, but you can't leap from where we are into the type of system that gives you a systemic change in society. You grow it, but we will need economic growth to back this up as we go forward.
Sure. Alex, I want to touch on that systemic issue a little bit later. I just want to jump back into the informal sector a little bit, because I think, well, certainly myself, and I'm sure for a lot of the members of the audience, we don't know all that much about the informal economy. And I know you've made some comments about it just now, but Rob, I wonder if you could maybe share some of your findings in your work that you've done there. Could that kind of, I mean, given that there's some barriers to entry in the formal sector for employment, perhaps is the informal economy possibly a kind of like a golden goose or a ticket that could assist in alleviating alleviating poverty, two, kind of like springing the economy or jump starting something happening. I mean, there's been stories of people using that COVID grant to start businesses that has helped them efficiently. So how do you see the interplay between grants and informal economy and the formal economy and the people that are involved there?
Thanks, Joanna, and thanks to everybody else on the panel. I hesitate to be introduced as somebody who knows something, because this is certainly one of those areas in which the more I learned, the more I realized I knew nothing. So the easy part of your question is the golden goose. That's easy. The informal sector is not the golden goose that will unlock the economy. But the rest contains more than a germ of truth, right? The informal sector is a critical part of our economy. Just because it's difficult to measure doesn't mean that it isn't a part of our economy, and so many people depend on it. So I think very briefly, to go back to my earlier point about knowing little, but knowing even more how little I know. I worked on a study of the options for retirement saving for informally employed South Africans. We sought to understand this group a little bit more closely, and there is some research. There are efforts to classify the members of this group, or at least to subclassify them into large sectors: agriculture, trading, backyards. They use a much finer term than that. And there are studies that seek to understand the daily challenges of people in the informal economy. But overall, the findings demonstrate incredible complexity, incredible diversity, incredible fragility. I mean, many of us know some people who work informally. We greet the gentleman who sifts through our trash and finds stuff of value in it, but we must be careful not to assume that he represents South Africa's informal economy. The first thing is that the informal sector is a misnomer. We need to be very careful of the words that we use. It's really not well defined. The closest we can get to that is the informal economy, but recognize that there's no one-to-one relationship between people who work in the informal economy and those who are informal in their economic activity. So people can be both formally and informally employed. Firstly, they leave a formal job and then they survive working informally as well. They can be formally employed in informal entities. In other words, they are employees, but they don't have the security of employment, and they work in a remarkable variety of ways. Most of them characterized by deep fragility. And this adds to Alex's earlier point that the environment is just extraordinarily complex, and that we need to be very, very careful not to support or even propagate blunt, unhelpful instruments that at best might benefit a small part, but at worst could cause damage in other areas. I think I better leave it at that. Thanks, Joanna.
Thanks. I just want to ask you the one thing you said, so they can be formally employed, but without the security of employment. I don't quite understand what you mean by that.
Okay, so I'm employed, right? I work because somebody pays me, but it's a backyard business. And so our stats can get it wrong. I can also be informally employed by a formal employer, right? So it's a registered entity, but they're not giving me the security of a job. And back to my earlier point that there are many who are informally employed in several different ways, and there are some that are both formally and informally employed. And so let's be careful regarding our not just our assessment of the statistics, but the generalizations that we make in our well-meaning efforts to understand this remarkable group of people. You also have those that are during the course of the year, both formally and informally employed. Consider those in the agricultural sector. Typically, they have work. It may be formal, but it's limited to a season. It may be informal, and it's still limited to a season. Then they may go on to other work in the agricultural sector, or they may have to go somewhere else in order to find work. So we have incredible duplication and complexity of working patterns. I think we should call them survival strategies. And for those that are interested, I urge you to find case studies that follow people that are surviving well, mostly surviving in the informal economy. Megan's got a question.
It's more an illustrative example of your people who are informally employed in the formal sector. So if you drive past a building site in the mornings, there'll be a queue of people standing there waiting to get paid for a day's work. They have no protection in terms of UIF. If they get injured on site that day, they have virtually no recourse. And at the end of the day, they get their pay and they go home with absolutely no security that they will get a job the next day. So that's an example of, a very formal employer who employs people informally.
Okay, so I mean, I think that thank you for that, Rob, because I think we do tend to, and as you say, well-meaningly, because we want to find a solution, and solutions are always easier to find if you can put everyone in a box with the same criteria. There's your problem, and there's a solution. But I think keeping in mind that there's huge variation in the actual thing that you're trying to solve. Even the problem that we define as a problem may not actually exist necessarily in the minds of the people that we are trying to help so desperately. But I think I want to link into the kind of like so I mean, being unemployed is obviously worse than being informally employed in whichever way, shape, or form. Having no food is worse than having some capacity to feed yourself. But I do want to talk about kind of the structural issue that Alex mentioned, because I think we can get stuck on little bits of information, like, is it okay if how far do you need to kind of go? I think especially when we're talking about grants, and it might be just me, you start off with the problem, okay, we have unemployment, people don't have food. Okay, give them something so that they can eat. Okay, that's great. Do we stop there? No, because we have a social problem. Do we stop at the informal economy? Do we stop? Where's the kind of like trajectory? I think given our circumstances, because there's a lot of problems and there's a lot of complexity. And I think, Megan, you mentioned a scary stat that I think for me was super scary about the number of job entrants that had come in versus the number of jobs that were open. That was super scary, and it talks to the structural problem that Alex was talking about. I can't remember the numbers, Megan. I think it was something like 700. Do you remember those numbers?
If we go full circle, between 2008 and 2022, there were about 7 million new entrants into the labor force. But only 750,000 new jobs were created in the formal sector. So, you literally have, it's a scale problem. There are only so many jobs being created in the formal sector because economic growth is low. You have, some movement in the informal space, but we're not sure how secure those incomes are. In fact, we're pretty sure that they're not very secure. And a point that Alex made, in the discussions is sometimes those are jobs we don't necessarily want people to have, like hijacking and drug dealing. So there's a problem there, in terms of where are we going to actually put people, as they enter the labor force. If the formal sector can't take them, the informal sector might not be an area we want to put them. Where do we go to from here? And Alex has his hand up, so I'm going to hand over to him.
Alex, do you want to take over?
Sorry, I didn't want to take over. Stop. Just to add a further point, which is just in terms of the categorization. There is an informal sector. There are people who are informally employed, and there will be a mix of people who are in both formal employment and informal employment. But then there is another term that's precariously employed. So this would be professionals. It can be artists, it can be people who are working intermittently and they don't have certainty of contract or income. But you can also have precariously employed workers, people who are cleaners, who are working for a contract company. So they contract with a formal sector organization, but the person who's doing the cleaning isn't directly contracted with the principal, the main organization, the people, the places that they're cleaning. They're working for somebody else. These are kind of labor broking organizations, and they are essentially creating a precarious environment in which there's no social protection, no insurance, no healthcare provided, just an income. And there's a margin being taken. So it can be quite problematic for some of those. So the issue is we've got a full spectrum. Now you can try and cure each one of these problems. So somebody might argue, well, insource or eliminate labor broking or force people to provide employee benefits. And when they do that, then they stop employing some people because it increases the cost structure. So this is the problem.
Well, Alex,
when you
that sounds like the problem. That sounds like the problem. It seems like a big web that's interlocked with all things. And as soon as you try to kind of like solve one part of it, you end up kind of unwittingly affecting a whole bunch of other things that you may or may not have considered that can have possibly even worse consequences than the thing that you've even fixed, even if you have managed to fix it. So maybe you can talk about that because you understand the complexity of the system quite a bit. So if you can take us slowly through the kind of the different weaves and strings.
So it means you've got to be very careful in how you build your systems of protection because you can do more harm than good. And so firstly, just also to look at just a further comment on the context is that it's not necessarily just the individual. An individual might be unemployed, but they're operating within a household context. And this can be an extended family, and there can be some people that are employed, some people getting grants, and others that are unemployed. Some people who are at school, some people that are disabled. Now, within that structure, you've got multiple sources of income, but what you're doing is you're starting to stretch now this is another version of dependency. You're starting to stretch the dependency within these households. So sometimes when you actually do introduce a grant structure, for instance, you're providing support indirectly to other people who might be in that household. So it's taking some of the pressure off the support structures and the dependency within the household. And that's basically what you're doing, is that you're introducing a protection framework. You're pushing people toward a larger pool. But social resources are also stretched. So you can look at different pooling structures to try and boost this. But you've got to be very careful that then when you introduce other measures, that you are doing it with an understanding of the full holistic framework of support. I don't think South Africa is properly configured for that. It tends to only deal with problems in silos, which is really dangerous when we're dealing with these kinds of very complex support structures. And it creates some of the lunatic proposals that get produced, because on the one hand, grants can be regarded as good, but you can't just triple the value of the grants and introduce them. You can't just require employers to be A, B, C, or D without other knock-on effects. And if you can't control for them, then be very wary of introducing them. And if you don't understand the implication. So what it talks to is an approach to policy making in this area. Some things are going to be cured, with the systemic things are not going to be cured by private interventions. They are very often going to be cured by social interventions. But there are so many ways to go wrong in the social intervention. It requires really good policy.
Alex,
yeah.
And what do you mean by social intervention? So when you
social
mention
is government, it's basically government. It's basically where it is a societal response, which is organized through using public resources and public capabilities. So it means that you can do things at scale. So now that's what I mean by a social intervention. It also means that if you put in place a social insurance structure, you put in place a social grant, you put in place labor activation strategies at scale. These are all things that can't be done by private sector on its own, or individuals or NGOs or international donor organizations who can only ever do piecemeal interventions. So but the problem is that when people organize social interventions, they can be clumsy and they can be badly designed. And that's really where the kind of the social conversation is really needed on these, because you can do everything else and you get that intervention wrong. You've now shifted huge burdens onto the private sector, onto households, and government isn't able to do its part. So I think that's really just the sort of the overriding message. There isn't a silver bullet. You have to consider in context the problems you're dealing with and solve them. And you have to solve them holistically. And that means you really have to do your job properly. I think we've got a long way to go before we kind of get that right. And our mix of institutions is far from close to being able to address these problems. So I think that as a way forward, it means the conversation has to get more precise, clearer, and more informed.
And who would be having that conversation? I mean, so now we're talking, I mean, quite structural things. So it's not just saying, okay, there's a lot of poverty, let's put in so we have this relief of distress grants, I'm going to call it the COVID grant. There's talk of extending that to the basic income grant. What are the complications, implications, and limitations of such a thing? Because I think often we think that or some individuals may think that is the answer to boosting the economy, 2, poverty alleviation, 3, mitigating the effects of unemployment. So how far can that go? And if that can't go anywhere, maybe let's first answer that, and then I want to maybe tackle the social programs that link back to work and how effective those are. And if those aren't, because whether they are or aren't, then kind of talking to the structural portions of these societal interventions that could be put in place, and why are we not doing them, or are we doing them and are we not successful, or what are the barriers? So kind of a 3-pronged question there, sorry. And anyone else can pitch in if you have something to say about that.
So
Because I think that's really the context. Do you know what I mean? Like, where do we start? How far can things go? And where do they stop being effective and we need something else? And where are we missing the thing? Because I think a lot of people are doing a lot of things or trying a lot of things. And it would just be helpful to know where it's failing.
So I think it's important to remember that public works are very, very difficult to do at a meaningful scale. A highly successful public works program might create 10,000 job opportunities. That's sort of as big as it
And by
gets.
public works, elaborate on exactly what you mean by that for the audience.
Right. So South Africa has the presidential employment stimulus, which is almost a program bringing together 15 government departments who are looking at various different ways of creating job opportunities. They're not necessarily creating jobs. Okay, so they might be creating an opportunity for someone to work, literally for one project to clear a field of alien vegetation. And so government has been working on this, 15 government departments, and in 2 years, they created 1.7 million job opportunities, which sounds fantastic, but I refer you back to the scale of the problem that we're dealing with. We're dealing with 7 million people who are needing jobs. And what was interesting is the bulk of those opportunities were from the Department of Basic Education. Now, it sounds like, okay, well, this is certainly progress, but sometimes it's progress that comes at a cost. There's sometimes concerns around public works programs about political gatekeeping. So the people who are getting the jobs might be the people who are well connected. The jobs are certainly still oversubscribed. Even in the most successful areas, they're receiving about 4 applications for every post that is being advertised. And these are not permanent jobs. People are learning some work skills on them, but they're not necessarily then being absorbed into the job market. So I think it's important to recognize that we have a very, very big problem, and even a very successful public works program might only create a small-ish dent in the bigger problem. I know that Alex has a lot of reservations about public works programs and how they can be designed to be more effective. So I'm happy to hand over to him here if he wants to jump in.
So the problem is when people see public works programs and special employment programs as a substitute for social protection. So at most, this provides a partial income to people, but very often the jobs that are so-called being created, they're not really being created. They're not a net improvement in the employed population in South Africa. Very often these are public works types programs, which would have already been done in a labor-intensive way, but in a normal commercial market where people would have been paid normal salaries. And now what happens in these special programs, they get paid less. So you're actually substituting income away from people who would have done that work. So you haven't created any job, you've basically just substituted. So this is why government itself can't really generate employment as such. You might say that they could generate a multiplier effect from these special employment projects, and there can be that. But if they've just substituted income away from what would have been the conventional project, you've achieved nothing. What you would want to do is potentially look at those kinds of government interventions that do have important spillover effects on economic growth, such as infrastructure expenditure done without the corruption. There you get the infrastructure, which is enabling for the private economy, plus you create employment and you get some multiplier effects in communities done. And that kind of investment can actually be done, because not permanent expenditure can be done on with borrowings. But the problem with special employment programs is they're not treated as a capital investment program, and they're funded out of current income. So you've got to have a clear idea in mind about what government is trying to do in the economy. It can't be the employer growth. It's got to stimulate economic growth. It will not be the growth itself. And if it stimulates that growth, it will get revenue from that growth. So that's what you want to achieve. None of the programs that have been considered in South Africa are catalyzing in nature. And now especially even an infrastructure program is not a social support program. So you still need to provide people with social support, regardless of whether or not you have these programs, because social support is really protecting people from contingencies, such as unemployment, and such as anything else that can result in the elimination of income coming into households. So you want to buffer households from that. But you're not necessarily going to provide a solution to their condition. These have to come from other programs and their linkages. And in terms of the investments in institutions that allow for labor activation, we have a lot of piecemeal interventions in South Africa, lots of little bits and pieces here and there for labor activation. They don't combine to be more than the sum of the parts. And what you really need is a much more structured framework in which there is in which you've got an industrial policy and strategy in South Africa that is tied in to the labor activation programs, which is tied in to your income protection programs. So then you're getting the maximum out of your income protection because you're identifying those communities most in need and you're prioritizing them for the labor activation programs. And you're also tying them to changing the nature and the fabric of South Africa's industrial base. Then you're really doing something. And all the piecemeal interventions added up together in South Africa amount to very little, both in social protection terms and in generating economic knock-ons. So we do have to change our mindset and basically focus on solving the fundamental problems.
Thanks, Alex. I mean, you say it as though that's the easy thing, just to fix the fundamental problems. I think that there's a lot of, I think it sounds like there's a lot of parts to the problem. I mean, there's one, the poverty thing, you know, the poverty issue, to the social issue, 3, the general economic issue within which it finds itself. So where you are struggling with a economy that's growing really slowly with a big unemployment population, it becomes difficult to start to solve that. And when you continue to have that problem, then you need to come up with other solutions to almost band-aid the sores that come up. That's almost what it feels like to me. I mean, if we had this infrastructure development, and pop in, you know, pitch in if I'm misstating grossly, but that's kind of what it sounds like. It feels like we're putting on band-aid solutions onto a bigger problem, because that one is kind of difficult to tackle. And while we wait for it to kind of solve itself, we need to deal with the repercussions of that problem, which then look like unemployment and look like poverty. Would that be a fair kind of assessment of the situation?
So it would. There's a fundamental problem in focusing government's efforts on getting economic growth right when it has basically sabotaged the economy in the last 10 years. The problem is that when your basic infrastructure starts to inhibit economic growth and development, so everything from Eskom to logistics services, your bulk transport systems, all of those things have failed in South Africa. We have gone backwards. All of those generate employment when you invest properly in them, but the corruption that has basically resulted in their failure is one that requires political will to address. Now, the problem is we can accumulate funds, capital funds for investment, but the question is whether that investment will actually hit the ground. That's a fundamental problem. We have to address that. Then pretending we can solve all the other problems that arise from these failures with other measures is fallacious. We have to solve them all. But I would say that there would be very few countries that can drive their way out of a situation that South Africa is in without basically getting the infrastructure spend driven to the right areas. And that in itself generates employment in and of itself, but so many knock-on effects. And when you do that and the economic growth starts to pick up, your other social programs that provide the social support structures become possible at levels that can have systemic effect. So you go into a a sort of a positive cycle. You start to build your way out of the situation we're in, whereas the alternatives send you in a negative cycle, a death spiral.
Okay. Is there, I mean, I don't want to really end off this topic with a doomsday scenario. We are running slightly out of time. We've got 10 minutes, so we can take some questions. I think I saw something in the Q&A which has now disappeared, but oh, it has been answered already. I think that I mean, that's the messaging that's kind of come from not just this talk, but from other places, obviously, and other conversations that many more senior people than us have had around the corruption, and that being kind of the prevailing reason for some of our problems. I mean, what really can we do about it, if anything, and who can do something about it? And please don't say nobody. And do you feel, what kind of trajectory are we on? Do you have a view on that?
Yes. So first of all, I don't think that it is all doom and gloom. I think that South Africa has many of the ingredients for getting everything right down the line. It does require that there is a sort of a public conversation that gets the focus on the right things and not distracted by other conversations. The conversation on getting the economy going again is very much one of corruption and getting the act together and doing everything one can to basically get our key public institutions that are behind that working fundamentally. The social protection regime is also very important in generating a positive social context going forward. We have enough resources. We have the ingredients for an economy that can grow very rapidly. The problem has really been that the corruption has basically interrupted our potential. So that's why it's such an important conversation. You think, coming from somebody who's working on social security, well, you see, all aspects of social protection and social security should be building on the positive effects of economic growth. It compensates for some of the inadequacies of economic growth on how society's incomes are distributed and wealth. But it requires that wealth and income are being built up in order for you to make sure that it is equitably distributed without undermining further economic incentive for economic growth and realizing our potential. So I think that if we correct a number of those things, and South Africa still remains a democracy, it still means that you can criticize the president and you won't be in jail the next day. You know, on the other hand, if you head as chief director in charge of supply chain management in the public sector, you might have a short life, if you're honest. And that's the stuff that we have to correct. But at this point in time, we are able to have public conversations. We are able to be critical. That's an important indicator of potential in South African society. We've got to have the right conversations. We've got to put pressure on government to do the right things. And it will respond in a democracy. People in positions of public authority must fear society in that respect. They must listen to them. They must respect them. And when that happens, you actually have the policy starting to converge on the things that should be done. We've had a decade in which, about a decade and a half, in which policy has not flowed in the direction it should have, but we can correct it.
And let's talk about this new, the New Deal, the new, you know, unity government, and that, has anything come from there that could give us some hope or give us some direction in terms of what we are talking about?
Yeah, so I think that it's a positive development. I mean, it might be termed a government of national unity, but what it has done is it's meant to be a government in which there's been an acceptance. It's very important that when power is diminished from an incumbent political party, one that has had almost absolute power for a long period of time, it's often very difficult to extract them from that without violence. In the South African context, we've seen that there has been an acceptance of a narrowing of that power, so it's dispersed. And where the democratic environment is taking root, it hasn't taken root in the provinces or the metros fully, but it's a start. it will be important for it to continue, because the ANC-DA IFP cooperation has actually indicated a level of maturity that is very positive. It's not completely positive, and it's not overwhelmingly good, because it's not a fair distribution of how the votes came out. But it's a huge start to developing a more mature approach to governance in South Africa. We have to now see that replicated in provincial government and in the metros, and we will start to see South Africa change. So Gauteng still remains in a precarious condition, because there hasn't been acceptance of a kind of mature collaboration at a political level. And that's the economic hub of South Africa. That's very problematic, and the question is whether that can be turned around in the next year or so. But it's a very positive sign. It's not complete, but you can see that it's changing behavior in government, and it is a dispersion of power. So we've deconcentrated power in public hands.
Yeah, which goes to that working together and having possibly more robust conversations and more kind of impetus into a system that potentially has areas that need looking at with fresh eyes, if I can put it like that. Is there anything from any of the panel? Is there anything that we could? I just want to touch on. We don't have time. Is there anything from the panel as a last closing remark from anyone on what we could be doing, or how we could be assisting the government in these areas that they are kind of dealing with in terms of the social security, informal workers, grants, etc. Rob?
Research. Continue to ask open-ended questions to the members. Make curiosity a norm. Do everything you can to understand the problems from your unique set of skills. Everybody's unique, and I think it's a big area in which the profession has made a difference and can continue to make a difference.
Thanks, Rob. Megan?
I think, touching on the work of the research committee here, as Rob says, there's a huge amount of research that needs doing. And as we heard from one of the speakers earlier talking about universities, research isn't lucrative. It's not something that one gets a monetary return from, but there is a large social return on it. So, to make progress in these areas, we are going to need more research in this area, and possibly also, more financial support from the private sector and from the profession as a whole. And by we, I mean all the researchers in this area, and it's very multifaceted. We're very reliant on the work that people like Tom and Lee do.
Okay, that takes us to the end of the session. I'd like to thank all the panelists. I don't see any questions in the Q&A. So thank you all very much for joining, and have a wonderful evening further.